Is hereby called to order. Pleasant good morning to everyone. I wanted to just briefly give a quick statement to express condolences and take the opportunity to share our concern about gun violence. Let's go to roll call. Mr. Clerk, can we please have a roll call?
Senator Marvin A. Blyden. Present. Senator Blyden present. Senator Diane T. Capehart. Senator Capehart absent. Senator Samuel Carrion. Present. Senator Carrion present. Present. Senator Ray Fonseca.
Present.
Senator Fonseca present. Senator Novell E. Francis Jr.
I'm here.
Senator Francis Jr. present. Senator Donna A. Fred Gregory. Senator Fred Gregory absent. Senator Kenneth L. Gittins. Senator Gittins absent. Senator Murray C. James.
Here.
Senator James present. Senator Milton Potter. Senator Potter absent. Mr. Chairman, 4 present, 5 absent.
Thank you. We have a quorum. Mr. Clerk, is there any correspondence to be read into the record?
Yes, Mr. Chairman.
Please proceed.
Dear Chairman Fonseca, please...
excuse me, Mr. Clerk. Please mark Senator Diane T. Capehart as present. You may proceed.
Dear Chairman Fonseca, please accept this letter as a formal notice of my late arrival to today's Committee on Health, Hospital and Human Services meeting, which is scheduled to begin at 10 a.m. in the Albee-Atley Legislative Hall in St. Thomas. Please have all circulated documents placed on my desk for immediate review upon my arrival. Thank you for your consideration in this matter. Kindest regards, Donna Fred Gregory, Committee Chairman of the Committee, Chairperson, Committee on Budget, Appropriation and Finance, 35th Legislature.
Thank you, Mr. Clerk. At this time, I'd like to take the opportunity to share our concerns about gun violence. We all grieve the loss of Virgin Islands Police Detective Delbert Phipps, Jr., and we send condolences to all his family and friends, the VIPD, and the entire Virgin Islands community. We must honor our fallen officers. Mr. Clerk, please also mark Senator Milton Potter as present. We want to give special welcome to the distinguished and honored Dr. Gardner. He will give testimony before the Legislative Committee on Health, Hospitals, and Human Services today. We'll be updated on the status of the kidney care and the state of dialysis treatment in the Virgin Islands. Mr. Clerk, can you please read Block 1 into the record?
Caribbean Kidney Center will provide an update on the status of nurse payment for the facility. Invited testifier, Dr. Walter Gardner, Medical Director, Caribbean Kidney Center. That concludes the reading of Block 1, Mr. Chairman.
Thank you, Mr. Clerk. I see Dr. Gardner is present in the well on St. Croix. I just wanted to do a mic test. Dr. Gardner, pleasant good morning. How are you doing today?
Good morning, sir. Fine, thank you.
Thank you. Dr. Gardner, you may proceed with your testimony at this time.
Good morning, Chairman Fonseca, Chairman, Vice Chairman Kenneth Gittins, committee members Noble Francis Jr., Marvin Blyden, Senator Blyden, welcome back. It's good to see you in good health. Diane Capehart, Samuel Carrion, Donna Fred Gregory, Maurice James, and Milton Parto. And to the viewing and listening audience. I am Dr. Walter Gardner. I'm the Medical Director and Managing Member of HealthQuest LLC, the parent company of Caribbean Kidney Center. Thank you for your time, indulgence, and attention. On July 7th, 2023, in this very place, you unequivocally and in a very tangible way demonstrated your commitment to and concern for the well-being and health of the many persons in the territory who suffer from kidney disease and require dialysis. Those patients, through me, send you their gratitude. On their behalf, thank you. This hearing is to provide testimony on the status of the negotiations of the government of the Virgin Islands to acquire your facilities. Also, kindly provide an update on your nurses' payments. I would like to draw your attention to the slides. First slide, please.
Media, please proceed. Okay.
This chart is a timeline of events as it relates to the negotiations with regard to the Virgin Islands government Health and Hospital Finance Corporation. Discussions began in March of 2023 when CEO of JFL, Doug Hoke, in an unsolicited email, asked me about the possible transaction between CKC and JFL for the CKC dialysis facilities. On March 6, Mr. Koch sent another email to me with some specifics about a possible transaction. On March 9th, Mr. Koch met with me and my attorney via phone to discuss specifics of a possible transaction. On March 14th, my attorney, Scott Downing, sends Mr. Koch a specific terms for a possible transaction. On March 31st, my attorney, Scott Downing, sends JFL's counsel, Patricia Welcome, a draft confidentiality agreement in order to share information for the possible transaction. Thereafter, there was no communication from JFL. In April, Mr. Lauren Klieger, counsel for VIGHHFC, emailed Scott Downing, my attorney, and they spoke about a possible transaction in St. Croix and also St. Thomas. My attorney sent Mr. Klieger the terms of a possible transaction. On May the 3rd, on or about May the 3rd, Mr. Klieger reached out to my attorney with proposals for St. Croix and possibly St. Thomas. On May the 4th, Mr. Klieger provided a draft non-disclosure agreement between CKC and the Virgin Islands government, and Mr. Klieger reviewed and revised that NDA, and the parties signed on May the 5th. On May the 5th through the end of May or so, CKC responds to requests for information from Mr. Klieger and the VI government. The VI government also promised to have appraisers do work on both our facilities. On May the 9th, Mr. Finch, the CEO of GJFLI and St. Thomas Hospital's Doug Koch, Tina Commission, along with Scott Downing, and Mr. Klieger was invited but was unable to participate, met in St. Croix to discuss possible transactions of both St. Thomas and St. Croix. On June the 8th, Mr. Klieger sent a letter of intent draft to Scott Downing, my attorney, for a proposed transaction of St. Croix and St. Thomas. On June the 12th, Mr. Finch notified CKC of his intent to visit the facilities in St. Thomas, and on or about the 15th of June, he did. Personnel from Royal Leicester Snyder Hospital also toured the facility in St. Thomas shortly thereafter. On June the 13th, after review and comments by Dr. Gardner, Mr. Downing, my attorney, sent back a revised draft of the letter of intent to Mr. Klieger. Between June the 13th and today, we've had minimal communications on the negotiations, other than on July the 12th, I received an email with the names of 3 appraisers. To date, the appraisals have not been done, and there has been no communication between the parties since mid-June. It's now almost August. Thank you. On a different note, on behalf of the CKC staff and management, I thank the 35th legislature for responding to the potential disaster in June. Our ability to continue to have the PAFD staff has allowed CKC to continue to treat the more than 120 patients and visitors to the Virgin Islands. Thank you. Our gratitude notwithstanding, CKC seeks clarification on the terms and conditions of Bill 35-1060, specifically the issue of repayment. In testimony delivered by CKC's Executive Director in June, Ms. Rodriguez stated that, I quote, "Perhaps one of the greatest demonstrations of our passion is that in our 2 decades of existence, there have been many circumstances in which our presence has meant the difference between major catastrophes and the continued survival of our dialysis community here in the Virgin Islands." And she listed several times that CKC was critical in the care of dialysis patients in 2010, 2012, and again in 2017 following the 2 Category 5 hurricanes. Then, CKC was the only facility in the territory treating patients who were not taken off island, and the first facility to accept patients returning upon their return, On each of these occasions, CKC incurred significant losses, treating a dozen patients daily without the expectation of receiving enough revenue to sustain its care or expending resources for equipment and staff supplies in anticipation of receiving additional patients. In addition, following the hurricanes, the Virgin Islands Department of Health policy was that CKC was not or did not qualify to receive FEMA funds. Therefore, CKC received no funds whatsoever. Today, while this legislature appropriated funds to defray some of the costs of clinical personnel, CKC still has the responsibility for and pays the salary of the remainder of its staff and all the other costs associated with its operation, some of which we discussed at the last meeting, including its operations, supplies, freight, utilities, mortgage, etc. The appropriation helps, but does not translate into CKC profit. And the meager insurance payments make for minimal margins. CKC therefore respectfully requests that this repayment condition, if applicable, be repealed. As far as the nurses' payments is concerned, PAFFA's staffing agreement with CKC started on May the 12th. Since then, PAFFA has submitted 4 invoices. All the invoices submitted for these personnel have been submitted to the Department of Health as required. I cannot confirm that PAFFA has received any payments to date. Through July 8th, the amount billed is $260,975.54. This is for 4 pay periods. An average is $65,228.89 per pay period. Projecting through today, approximately 50% of the appropriated funds has been spent. At this rate, the allocated funds will be consumed on or by about September 30th. Oh my God. I have left a page out. I don't have it. I'm embarrassed.
We have it. I have it. I'll have the clerk complete the reading, or I can do it myself.
Good. Thank you.
Mr. Clerk?
I've got it. Thank you.
You got it? You found it? Okay. You
Yes.
got it. Okay. You may proceed.
The timeline reviewed earlier indicates that with the continued careful stewardship of the appropriated funds, the window for the conclusion of negotiations for the acquisition of the CKC facilities closes on about the end of August. At that time, CKC will find itself in the same critical position that necessitated its June closure. Senators, a definitive solution to this problem must be found. Thank you.
Thank you very much, Dr. Gardner, for your testimony. You know, we have to act with a sense of urgency. There are over 250 residents in the Virgin Islands receiving kidney dialysis treatments. And the treatment for kidney dialysis is 3 times a week. And as the Committee of Health, Hospitals, and Human Services has witnessed in your clinic, the people them have to be in a chair for 3 to 4 hours 3 times a week. These kidney dialysis patients rely on this treatment. It's very urgent and critical care. If they don't get this, the people can die. The closure of Caribbean Kidney Center will be unconscionable. There is high demand for this dialysis treatment territory-wide, as well as the ongoing need for community-based preventive and urgent health care intervention. So I'm urging the Hospital Territorial Board, which manages the Wang Louis Hospital and the Roy Lester Snyder Hospital. They must work with a sense of urgency to immediately acquire the CKC kidney dialysis facilities or lease or whatever. We're not getting into any disclosure. We don't want any information. You know, I spoke to the chairman of the Wang Louis Hospital, who is also the chairman of the VI government hospitals and health facility boards. And he sent a letter. He was provide testimony, but he sent a letter. Basically, he couldn't come here because he don't want to violate and reveal and all of this. But you know, last Friday in the budget hearing, I sat right there in that chair. I was sitting in Senator Javon's James' chair, and I asked Mr. Doug Cook last Friday in the budget hearing, I said, Mr. Cook, can you tell me if Wang Louis has the capability to treat the kidney patients in St. Croix? He said no. So that means there are kidney patients in St. Croix and St. Thomas, the same with the Roy Lester Snyder Hospital. They cannot treat all of the kidney patients. This is an emergency. So we are asking to please get this appraisal completed. As you can see, the legislature appropriated $700,000 to continue these payments, and we're receiving testimony today that there's no sense of urgency. We have to get this thing done immediately. No one is forcing you on the price, but we are forcing you to get the negotiations done. Okay, with that, I think we need to go to a round of 4 minutes. And we will begin with Senator Marvin Blyden. Senator Marvin Blyden, you're recognized for your 4 minutes.
Thank you so much, Mr. Chair. Good morning to my colleagues. Good morning to the viewing and listening audiences, staff, central staff, and good morning, Dr. Gardner. And thank you for your testimony. Based on your testimony, you basically laid out a timeline of different events. You first spoke to March 3rd. You had this discussion. You had a meeting. And then you spoke to March. No, I'm sorry. I'm tripping. You spoke. No, that's okay. You spoke to different other dates in terms of you having a draft agreement. And then you spoke to May the 5th and then June the 8th. And on May the 5th, you spoke to basically them giving you name of 3 appraisers. And up to now, nothing has happened. So within that window, several months have passed and still no movement in terms of coming up with a solution. Now, in your testimony, you spoke to how many patients you treat. How many patients do you treat on an annual basis?
I rather address that issue more as a total basis. We are currently treating approximately 120 patients in St. Croix and St. Thomas combined.
Okay, very well. Thank you for that. And you spoke to the government in terms of us assisting with the $700,000 in assistance. How much of CKC's funds have been utilized for say, the payment of salaries?
How much of CKC's funds?
Yes.
I'm not prepared to answer that question this morning. I just don't know the answer off the top, and I don't want to give you inaccurate information.
Okay, very well. Let me ask you another question then. Did CKC receive any PPP loan or any other federal loans or grant to assist the center during that period?
Yeah. Yes, CKC did receive some funds from the PPP loans, which has since been forgiven.
Okay, how much were those? What the amount of those funds?
Some, I would say $200,000, but I'm not. Again, that's not an exact figure. I wasn't prepared to answer that kind of question this morning.
Okay, very well. That's fine. But I would just like to state, for the record, though, I think it's unacceptable in terms of the position we find ourselves in terms of holding the dialysis patients of this territory hostage because we do not have basically all of the resources in terms of funding to take care of them. Why I say that, because in the testimony and in the discussions, it was stated that, with more than one center, it's going to be an issue in terms of how many patients, it's going to take to keep those centers alive. So I think we need to find a way to either have yourself and or another non-for-profit basically run dialysis here in the territory, whereas we can basically keep the numbers and have the funding in place to assist those individuals. So I guess we'll have further discussion at another time. So, Mr. Chair, I want to thank you, and Dr. Gardner, thank you so much for what you do. Thank you.
Yes, thank you, Senator Blyden. And, that brings up another idea. I want to follow up what Senator Blyden was saying, because it's to my understanding, Dr. Gardner, that Caribbean Kidney Center can provide training to nurses so that they can become specialized in dialysis treatment. So I want you to go ahead and tell the listening audience what would be the qualifications they would need to come to you. When they come to you, how long it will take for you to train them, and then, very important, the salary that they would be making in dialysis specialty treatment.
Well, there are two categories of personnel, clinical personnel in the dialysis facility. They are the RNs, registered nurses, without whom no dialysis can occur. An RN, at least one RN, must be present on the floor at all times while dialysis is being performed, so that we need, first of all, registered nurses, and then there are PCTs, patient care technicians, who do the bulk of the work in terms of physical stuff. We at CKC from the very beginning recognized the need for training of locals so that we can find and retain these people. We have trained several RNs, and we have trained several PCTs. A training period for a PCT is roughly about 3 months. A registered nurse, before she can be in a charge position, requires 6 months. Like I said, we have trained several RNs and several PCTs in the past. However, you have to be an RN before you can be trained. You are required to have an RN and an RN license. Part of the problem here in the Virgin Islands is that there aren't enough RNs, period, so that we can't even find RNs to train. For PCTs, we require a high school diploma as minimum qualification, and we've had several people who have been CNAs who have been trained as PCTs. And we've done that, and we've done that very efficiently. And quite frankly, in St. Croix, we have no perfect PCTs. In St. Thomas, it's a little different, since training in St. Thomas requires a little more resources. We've not been as successful as we have been in St. Croix in training PCTs. As far as salary is concerned, the RN salary range has gone through the roof with the recent passage of a bill that I guess codifies RN salaries in the Virgin Islands. PCTs are paid somewhere between $20 and $25 an hour as PCTs. Now, those numbers are compared to what we are paying Pafford at this time. which is astronomical. And that's the reason why we've been having difficulty recruiting RNs and to a lesser extent PCTs since then. Every RN that we find that is willing to come to the Virgin Islands to work with us, eventually, and quite frankly, much more rapidly than I would like, find out about PAFID and their pay scales, and then applies to PAFID instead of us. Similar things happen with the PCTs as well. So even when since the last hearing, we have continued our efforts to try to recruit nurses. And we have identified a couple nurses who in conversations agreed to come with us and later called us and said, we're going to come through PAFID. And that's what's happening. So it's becoming not less difficult, but actually more difficult to recruit candidates now.
Thank you very much, Dr. Gardner. Now we'll go to our Honorable Senate President, Senator Novell Francis. Senator Francis, you're recognized for your 4 minutes.
Thank you very much, Mr. Chairman. Good morning to you. Good morning to my colleagues. Good morning to the people of the Virgin Islands. And of course, good morning to you, Dr. Gardner. Again, I want to thank you for all that you do in regards to your role and responsibility with the CKC and providing dialysis care to our patients here in the Virgin Islands. This morning's discussion seems to be somewhat twofold. In my understanding, one is the purchase of the CKC and the acquisition by the government of the Virgin Islands in acquiring your facility, as well as two, the continued patient care. And of course, we're talking about the quality patient care that seems to be very much tantamount in our discussion here today. So I wanted to take this in stride. First of all, I believe from your testimony you have indicated that in fact the government of the Virgin Islands are very much interested in acquiring your facility, and they have made some effort to do that. There's some negotiation that's occurring, and here in government we wish that the pace would be a lot faster. I get frustrated every single day and after spending almost over 30 years in government, I wish government will function a lot faster. So you spoke about the discussion that you've been having with the board, as well as the CEO of the hospital and both hospitals. You're required to provide 3 appraisal. I know you mentioned these 3 appraisal. Is it your understanding it's your responsibility to get these 3 appraisals, or what happens with these 3 appraisals? Is the government responsible for getting them? What is your understanding?
My understanding is that the law in the Virgin Islands require that acquisition of any, as I understand it, I'm not a lawyer, acquisition of any real estate requires 3 appraisals. This transaction would involve the acquisition of the 2 facilities, the facility on St. Thomas and the facility on St. Croix, and therefore 3 appraisals are necessary, or required, I'm sorry. I'm not sure it's necessary. However, that seems to be at least one of the problems holding everything up, as I understand it. However, I'm more concerned about, I'm not less concerned about the appraisals, but I'm concerned more about the fact that the negotiations are not moving anywhere. I mean, we don't have decisions, or at least tentative decisions can be made with regard to moving forward, conditioned upon certain parameters set for the appraisals. But even though that's not happening, and my concern has to do with the fact that we're going to get to August 31st of September, funds are going to run out, and I'm going to either have to come back to you guys and ask for more funding.
Yeah, one second, but Dr. Gardner, you have not answered my question though. in your understanding, who's responsible for acquiring the 3 appraisal? Is that your responsibility?
No, it's not. It's not CKC responsible. No.
Is the
It is
government's
the
responsibility?
Absolutely.
Okay, so in your communication, obviously, with the government, you're inquiring or you want to ensure that, in fact, the process of acquiring those 3 appraisals is being done. Yes or no?
Oh, I'm sorry. I didn't get the question. Say it again, please.
Again, here today, one of the things that seems to be the salient point here, because we're almost stuck as a result of not having the 3 appraisals. That's necessary and it's needed in order for the transaction to move forward. So I guess that's something that we could do as a body, is to inquire whether or not, or what's the status, and being able to get these 3 appraisal. All right. In the meantime, you will continue to provide a quality care to our patients there. You spoke about something being repealed, some payment being repealed. Can you expand on that discussion quickly for me before my time runs out?
I'm sorry. Yes, I will. It is my understanding that, and I don't know, I'm not going to profess to be expert in any of this situation. It is my understanding that there was an amendment to the bill that was passed requiring that the money be paid back, the $700,000 be paid back by CKC. And it's not totally clear to me. I'm not going to try to tell you exactly what the situation is, but if that is a correct, what I'm saying is, if that is indeed true, we would like to ask that amendment be repealed, please.
Very well. I guess we'll take a look at that. I remember the discussion at the time was that the amount should be a part of the sale moving forward. Whether that will be offset, in terms of the transaction. But that is something, I guess those individuals that's involved in the transaction will make a determination on there. For this body, it was important that we provide the necessary funding so that at least the patients could continue to receive the care that's required there. Do you receive any reimbursement whatsoever from CMS?
Yes, we do.
Okay, and is that up to date? And
we continue to bill for the services that we provide. Yes, and we are reimbursed by the various insurance companies, Medicaid, Medicare, and in the few cases that it applies to private insurances, yes. But as I tried to demonstrate in the last hearing with a conversation with Senator James, the funding, the reimbursement that we received from the various insurances leaves a very, very minimal margin. That was before the cost of nursing skyrocketed the way it is now. With the increase in the cost of nursing alone, those funds, those reimbursements are no longer applicable, and we are operating in a loss. As I said in the last hearing, $75,000 at the time, that was the first invoice that we got from Pathward for the first pay period. $75,000 every pay period is not sustainable for us, certainly. And that was the reason why we threatened, the concern about closure came up. This is not about CKC, me, or money, it's about the patients. And we want to provide services at a standard that we can feel proud of. And to do that, the expenses that this this two payment pay scale requires is just not sustainable.
Very well, my time has been called. Thank you very much, Mr. Chair. I would say, though, one thing is that it's all about finances, because money is what's driving this whole discussion, one way, shape, or form, the continued existence of it or the lack thereof. So that's what we have to focus on. Thank you very much.
Yes,
Point of
definitely.
information.
Yes, Senator Maurice C. James, you're recognized for your point of information.
Thank you, Mr. Chairman. With respect to the appraisals, you said that you were provided the names of 3 appraisers from the government. And really, the status for me would be, has any appraiser been to your facilities to begin the appraisals?
No.
So that hasn't happened yet?
That hasn't happened yet.
Okay, and I know that appraisals take sometimes 3 months or more. So for my colleagues, that should give you an indication that because appraisers have not appeared at the facilities, that means that this is pushing it back several months. Also, do you have a percentage of how many patients are Cigna and how many patients are Medicaid, Medicare?
I should have that information. I don't. The majority of our patients are Medicare and Medicaid. I would say the number of private insurance patients, not just Cigna, but private insurance patients, would not exceed 10.
Thank you. Thank you, Mr. Chairman. I'm going to have to take leave for another meeting, so thank you for giving me this opportunity.
You're welcome.
I will follow up directly with Dr. Gardner with some of the questions that I have. Thank you.
Thank you, Senator Morris C. James. I wanted to follow up real quickly on that appraisal issue because, we recently confirmed Commissioner Mrs. Alejandro for Property and Procurement, and I asked that particular question, and it's my understanding that Property and Procurement does not have an appraisal. As a matter of fact, that was also an issue with the Department of Labor when they were here just last week, when they are in the process of purchasing their building. And of course, we got that famous big land swap deal with Whistling Kid. That also involved appraisal. So I'm going to have to investigate to see if the government of the Virgin Islands have an appraiser on staff, because it seems like there's a lot of work for an appraiser. Next, we'll go to Senator Diane T. Caput. Senator Caput, you're recognized for your 4 minutes.
Thank you, Mr. Chair, and good morning to my colleagues. Good morning to the people of the Virgin Islands, the listening and viewing audience. And Dr. Gardner, thank you. Thank you for all that you do. I feel that there's no sense of urgency to this humanitarian crisis that is threatening the health and safety of these 120 patients. Would you agree?
Yes, ma'am.
So with that being said, since the tour, what can you report to this body in the name of a definitive progress towards a resolution? Do you see any?
That's precisely my concern. I do not see any. And with the window closing as rapidly as it is, I'm very concerned.
I am very concerned myself because I go all the way back from 1989 Hurricane Hugo, where we realized that there was a problem. We have to, I don't know what the solution is other than giving money, explaining the urgency of the hospital, understanding that this is a priority. I'm going to get off my soapbox, but Wang Lurie has reported that they are able to hire 2.5 more nurses in place of contracted nurses. Is there room for a partnership to hire more dialysis nurses?
Absolutely. I have tried, but let me say parenthetically, we have worked with JFL every step of the way when we've been able to. We have made proposals and suggestions, not to regard nursing or hiring nurses, about, for example, bulk purchasing. One of my arguments continue to be, and I know this is not a popular argument because there are several people in this body and elsewhere who don't agree, and I can understand that. But I have always, since 2007, been of the opinion that neither island can support more than one dialysis facility and be profitable. Okay? The number of patients that it requires to accomplish that just isn't there. There are not, right now, roughly about 100, 120 patients on St. Croix requiring dialysis services. That would probably, in one facility, that number of patients can result
1 minute.
in a facility being profitable. In St. Thomas, the numbers are similar. In St. Thomas, we had the experience where a third facility came, Trung Bay, opened and had to close within 12 months because of sustainability. I can tell you, speaking for CKC, that we are operating on a very thin margin. And we have to be extremely cognizant of expenditures in terms of just to stay afloat. We've been proud of that, the fact that we've been able to survive for 20 years, doing a reasonably good job. And we would like to continue to do that. However, this new crisis of personnel has pushed us beyond the point where we can survive. And we have to recognize that and admit to it and attempt to do something.
Time.
The sale of my facility is an option. It was not my first option necessarily, but it is an option. And the object here is not who owns the facility. The object is that the facilities exist. So that if the government wanted to acquire these facilities, I am willing to sell the facilities.
Thank you for that response. Mr. Chair, if I might just have one last follow-up question here.
Yes, proceed.
Thank you. The Medicaid recipients, if you can take me through that process. Medicaid recipient who may have to come and have services 3 days out of the week. What is the process for a Medicaid recipient after they may have gotten the approval from special services to then go to the hospital or your facility?
Well, the patient has the choice of either going to the hospital or to our facility. We accept all Medicaid patients.
Okay.
In fact, I would say to you, somewhat embarrassingly, the majority of our patients either have Medicaid as their primary or as their secondary insurance. So Medicaid provides a major part of our revenues.
So they don't have any challenges as it pertains to getting the approval to come to your facility?
No, the acceptance to our facility is pretty much universal. It's based primarily, there are very few circumstances where we do not accept patients. And I will give you an example. Right now, given the personnel shortages that we're experiencing right now, there are certain quote-unquote special needs patients that we have been unable to accept because we don't have the personnel. Let me give you a tangible example. There are patients who are obese, who have lost an extremity, a leg, who cannot transfer easily to the scale or to the dialysis chair without additional help. Now, if we had additional nurses, additional personnel, we can accept these patients. But then, given where we are right now, we don't have enough personnel, we accept a patient like that. It puts additional pressures on our personnel, making it more difficult for us to perform. Now, this has been, I'm glad I had the opportunity to explain this to the community as well, because the impression out there is that we are being picky about who we admit. That has nothing to do with it.
So you have many challenges to
Absolutely.
deal with. Thank you, Mr. Chair, for the extra time.
Yes, and thank you to the Honorable Senator dressed in red today, the Honorable Rules Committee Chair, Senator Diane T. Capehart. Thank you very much. You know, the kidney dialysis, there's over 250 residents on kidney dialysis. And right now we're again on the brink of a kidney dialysis emergency. The closure of Caribbean Kidney Center is unconscionable. We cannot let it happen. So I'm again urging Christopher Finch, you seem to have the primary role, property and procurement, Doug Cook, everybody that's involved to get together, sit down. We cannot afford to lose one single life. Dr. Garner, I wanted you to specifically explain this to me because the community need to know what it is to be a kidney dialysis patient and how it affects the family. So tell me, how would a family be affected and what does a dialysis patient have to go through every week?
Being a dialysis patient is extremely difficult. It's not, I would not wish it on anyone. Unfortunately, the alternative is equally unacceptable, and we are happy to be here to provide the services that we do. A dialysis patient is required to come to the facility. Well, in addition to the physical requirements of coming to a facility 3 times a week and sitting on a chair for 3 to 4 hours being dialyzed, that in itself is a tremendous ask. Added to that is the fact that these patients are being asked to be on a strict diet, to take medications regularly, to limit fluid restrictions, etc. And it's a tough life. So that we try to do everything we can to make it as tolerable as we can. Regrettably, sometimes the patients are their own worst enemy by not complying with those requirements. However, that notwithstanding, we try to do the best we can to provide and make their lives as simple as possible. We have social workers, dietitians, and a bunch of adjunctive services, transportation, to try to make this as tolerable as possible. And I think to a certain extent we succeed. But it is nevertheless a very difficult time for the patients and their families.
Thank you very much, Dr. Gardner. Next, we'll recognize Senator Samuel Carrion. Senator Carrion, you're recognized for your 4 minutes.
Thank you, Mr. Chair. Good morning to you. Good morning to my colleagues, and good morning to the good doctor that is here before us this morning. I want to thank the chair for putting this on today's agenda, and the doctor for being present here to share what's been going on. We really wanted to find out and hear a testimony about the status of the negotiation. That's what you were requested to come here before us to share, and the status of the payments for the nurses. What's the status on that? It's unfortunate to hear, as you expressed and you clearly stated in your presentation, the timeline and where we are today. It's really concerning, and I must say, to a certain degree, alarming. Because when this was presented before us, it was presented as a critical crisis. And it is, and you share that today. And this body moved to special order. This was sponsored. This was special order on the floor. Some amendments were created because we understood the importance of the patients. We understood the need, and we couldn't leave our patients without receiving the services that they so much need. And to hear today you come before this body and tell us where we are, it's concerning. It's concerning because it seems to me we're not moving in a sense of urgency. This body did. We moved. But the other parties seem not to be moving in a sense of urgency. And it's very concerning. Now, from your testimony, you mentioned that 4 invoices have been submitted thus far. And based on those 4 invoices, you said that 50% of the funding has been observed by those 4 invoices. Now, within your preliminary agreement with the hospital, do you have set a window period by when the negotiations should be concluded?
No.
Okay. So these negotiations can go on for how long?
I guess theoretically forever. I mean, negotiation of this kind is tough to make it put a time frame on it, but certainly can be done effectively and efficiently.
And then based on how you ended your testimony, you were saying the timeline review earlier indicates that within the continued careful stewardship of the appropriated fund, the window for conclusion of negotiations for
1 minute.
acquisition of KCK facilities closes at or about the end of August. So were you verbally told that there would be a closing at some point?
No. What I'm saying is the funds that were appropriated, the $700,000, at the rate of which it's being spent right now for nurses, those funds would expire on about sometime between the end of August and September, sometime in September. It's very difficult to give you a specific date simply because the periods vary in length, over time, et cetera, et cetera. But just projecting, about 50% of the money has been spent. You put another time on it, and somewhere between the end of August and sometime in September, those funds are going to expire.
The remaining funds will be expired.
Right. Now, when those funds expire, I'm going to be right back in a position where
Time.
I have an agreement with Pafford to provide nurses at these rates, and I'm not going to be able to pay it. And I will have no option but to close my facility because I cannot incur additional expenses.
Mr. Chair, if I may, I know my time's in call. Last question.
Yes, you may proceed, Senator Carrion.
Thank you. Have you received any federal funding, or are there any grants of federal funds that are available to assist you? And if you have, what have you received thus far?
Okay. The answer is we have not received any. We've not applied for any. Being a for-profit company, grants are not as available as they would be otherwise. Or if they are, I'm not aware of them. So that we are basically functioning on our own dime, so to speak. And if that dime was big enough to continue, I wouldn't be here. The fact is, when it became inevitable that, and let me put it another way, as of May the 11th, the funding which the territory was using to pay Pafford ended. When those funds ended, the Pafford nurses basically were no longer on contract. I entered into a short-term contract with Pafford directly, where I was responsible for these services, in the hope that the negotiation would have gone much more quickly. We'd have gotten to a point, and a short-term exposure would be something I can tolerate. When I got that first invoice, I knew short-term was now, and that's when I came and requested help, and thank goodness I was granted some help. Now I'm keenly aware that that's not a situation that is going to repeat itself indefinitely, and hence the reason why I'm here with this concern.
Thank you. Thank you, Mr. Chair. I just wish that we had a representative here from the joint board of both hospitals to really speak from there and what's their status, because it seems to me that the ball is in their court and we need to really have a sense of importance and urgency on this matter. Thank you, Mr. Chair.
Yes, thank you, Senator Carrion, and that's a very good, valid point you made. We in fact invited Christopher Finch, the chairman of the Wang Louis Hospital and the chairman of the VI Government Hospitals and Health Facilities Board, to be at this meeting, but he sent me a letter said he will be unable to attend due to HIPAA and all of these kind of things. Senator Diane T. Caput, you're recognized for your point of information.
Thank you, Mr. Chair. It's interesting how people run away from dealing with the pertinent questions that we need to ask for, as I said again, a humanitarian crisis that we are not really taking as an urgency to these individuals. And I just wanted to ask, as it is so important for so many different factors of a dialysis center, the temperature, the air conditions has to be the right temperature, correct? You need patient privacy. You need a dialysis area. You need storage area, power and supply and plumbing. And one important thing that I want to ask, how do you filter your water? How important is this?
That's absolutely important. We have an elaborate our reverse osmosis system in our building, in both our buildings, that meet the AMI standards prescribed by CMS, and that's the water treatment plant that we have within the building itself.
So when that water is filtered, do you have any discharge of water? How is that process also done?
We are connected to the sewer system, and all the discharge water go to the sewer system. We have a system as well of recycling some of the water that's being utilized, so that we can decrease the water needs per se. But the bulk of the discharge water is sent down to the sewer system.
Okay, so you don't have any issues as it pertains to not enough water or the draining system?
No, we also have, in both facilities, we have cisterns that provide us a backup source of water should there be a cutoff, because patients need to be dialyzed anyway. So.
Thank you. Mr. Chair, if you allow me to ask one more question, as I know we're not having a second round. In the last testimony that you provided to this legislature, we spoke of many individuals are being treated off island. Do you know of any that were being treated off island that have returned home?
We have that happening every day. Okay. There's an active traffic of patients leaving the island and patients coming back to the island. The patients that are all patients that leave the island, we are pretty much obligated to accept them upon return when they come back, and that's not a problem. What was alluded to at the last conference was that there were other nephrologists who had patients who were either expecting to be going dialysis soon, or who are away on the mainland being cared for, who are going to be coming back home. And we have been happy to accept all those patients when the time arrives.
Wow. Thank you, Mr. Chair.
Yes, you're welcome, Senator Caput. Senate President Nova Francis, you're recognized for your point of inquiry.
Thank you very much, Mr. Chair. Dr. Gardner, I know from my previous conversation, there were some challenges in regards to an asking price for the purchase of CKC. Have you been able to rectify that matter? And have you communicated with the government of the Virgin Islands, either through the board or through the CEO? What's the asking price for your facilities?
I would not like to, with all due respect, sir, I would not like to involve any of the negotiation factors in this meeting, public meeting.
No, I'm not asking you what the price is. What I'm asking is, have you been able to convey to them your asking price? We have conveyed to them prices that we would consider and the reasons why we have those numbers. So it is your testimony and record today that yes, you have indicated exactly what you said, prices or price?
choice.
Very well. Thank you.
Thank you, Senator Novel Francis. Senator Milton Potter, you're recognized for your 4 minutes.
Thank you very much, Mr. Chair. Good morning, colleagues. Special good morning to you, Dr. Gardner. Thank you for what you've done or what you've been doing with regards to the treatment of persons with kidney disease here in the territory. I know that dialysis, without question, literally serves as a lifeline for people who are suffering from major kidney disease. And without that service, as you mentioned, as bad, as challenging, as difficult, as stressful physically, emotionally, as the process of dialysis is, the alternative would be far worse, without question. And one thing that didn't go unnoticed to me the first time you were here, and this time also that you were here, it seems to me as though you're saying that the current model, the current business model based on the cost of dialysis nursing and escalating costs all around, it's not a sustainable model for a business to be profitable, to be successful. And I am assuming you were successful in, running your dialysis center for, I believe, upwards of 20 years. But based on the current market forces, I'm assuming that you're saying things have shifted, and it makes it virtually impossible if you have multiple dialysis centers, private dialysis centers in the market. It makes it virtually impossible for any one of those entities to be successful without some sort of government monetary intervention or support. Am I reading you correctly with that?
Yes, you are, Senator.
Okay. Without going into the intricacies of your negotiations, and I wouldn't put you in that position, and you gave us the chronology of events and timelines of things that have happened, and you're not comfortable, from what I have been able to glean, you're not comfortable and confident that we will be able to conclude these negotiations by the end of August, when the funding that this body provided you is slated to run out.
1 minute.
That's correct.
Okay. So it puts as difficult, as strenuous, physically and psychologically as this process is, it is really unfair that our dialysis patients have to bear that additional burden, the additional stress, the additional level of uncertainty as to whether or not their treatment will be able to continue following the expiration of the funding. So if these negotiations are not successfully concluded by the end of August, where does that put the 120 plus dialysis patients who are currently under your care?
Time.
It puts the patients in a very, very bad position. We heard information from the chairman that he was told that neither Royal Leicester Schneider nor Juan Louis hospitals can accommodate all these patients, and without an alternative source of patient care, these patients will be left high and dry. This is exactly my concern. First of all, I hate to see that happen. I don't want to see it happen. I've done everything I can to make sure it doesn't. But if something doesn't happen soon, we are going to be right there again.
Mr. Chair, if I may just wrap up. So just to be candid, just so we can all be on the same page so that there won't be any surprises, are you saying that in order for us to continue with the services, in order for you to continue beyond August of September, should this funding, should this the negotiations not conclude, that realistically you may be seeking, or it may require additional funding from this body to bridge the gap between when negotiations are successfully concluded, to bridge that gap? Is that what you're realistically saying right now to us?
Regrettably, yes.
Okay. Thank you very much, Dr. Gardner, for your candor. Thank you, Mr. Chair.
Yes, thank you, Senator Milton Potter. You see, so this is what we're faced with, ladies and gentlemen. You know, Doug Cook, the CEO from the Wang Louis Hospital, right here, Friday, today is Monday, he told me Wang Louis does not have the capacity to treat the dialysis patients on St. Croix. Also, Tina Commission and St. Thomas, the CEO, does not have the capacity to treat the dialysis patients. We must avert a dialysis emergency. These 120 dialysis patients, they have nowhere else to get treatment. If this center would close, these patients, the 120 of them, would have to present to the emergency room, and this would dramatically increase the emergency room wait time. It would also dramatically increase the overall uncompensated care of the hospital. We cannot afford for Caribbean Kidney Center to close. We must prioritize dialysis treatment. These are our people. Dr. Gardner, I wanted to follow up on one question that was asked. You was talking about dialysis patients off island. Are there Virgin Island residents that are off island receiving dialysis treatment that would like to come back home?
Yes, sir.
You see, and this is what I'm talking about. This is important. Go, proceed.
I'm sorry.
Yes, proceed.
These are patients who either were sent off island for care that we were not able to provide here locally and are looking to come back home, or patients who was referred to the mainland for care of their dialysis of their kidney disease and have progressed to dialysis, or started on dialysis in the States and now want to come back home.
Okay, thank you. And what we're going to do is I'm going to allow a burning question, because I want to make sure I'm very considerate with the staff of the legislature, because all of last week, everybody has worked overtime. And you know, while we have a very competent and professional staff, we cannot allow for burnout, because this week is a real busy week. You know, I have a commissioner, I'm the chair of the Health, Hospitals, and Human Services Committee, and I'll go into that in block 2. So, colleagues, I'll allow a burning question. If anyone has a burning question, I'll allow that. Senator Novell Francis, you're recognized for your burning question.
Thank you very much, Mr. Chair. Dr. Gardner, I wanted to ask you on record, obviously we're relying on you to be able to remain healthy and well to provide quality patient care. How are you doing under these adverse conditions?
Thanks for asking, Senator. It's been difficult. It's been extremely difficult. First of all, running a dialysis facility under these circumstances in itself is difficult. Having the burden of having to realizing that at some point in time I may be disappointing and letting down a lot of patients and a lot of other people is not easy to carry. I would do anything to get to a resolution of this issue, because that too is not sustainable. My health and other concerns notwithstanding.
Thank you very much. So I will continue to implore, and hopefully, we could get the stakeholders together, because again, the closure of CKC is not an option. Thank you very much for the time, Mr. Chair.
Thank you, Senator Nerval E. Francis Jr. Dr. Gardner, one final question. Let's discuss prevention, because there are things that happen before you get to dialysis. So can you explain to the listening audience, first of all, the average age of the dialysis patients and some of the things that we can do so that we can avoid having to come to see you 3 times a week, 4 hours each visit? Let us know what the community can do to be healthier.
Well, first of all, the 2 major causes of dialysis in the territory are diabetes and high blood pressure. It is therefore imperative that persons with these 2 primary diseases, or combination of both, be extremely attentive to the medical advice that they're given, be extremely compliant with their medications, and follow up with their physicians. I also need to say that it is imperative that the primary care physicians in the territory refer patients with kidney disease to the nephrologist early enough that preventive measures can be instituted. It's pointless to send a patient to a nephrologist when he or she has basically arrived at end-stage disease or close to. There are very little options at that point in time. There are lifestyle changes, medications, etc., that the physician can, that the nephrologist can institute based on the diagnosis based on the cause of the kidney disease that could help. That's about what that's the best I can personally offer at this time.
Okay, and one other question, because the kidney dialysis also affects the family members, and then there's a kind of thing that you have to put into your hand that you basically have to use it for basically forever, right? Explain to us that process, so that I want the public to know how serious and important it is to prevent getting to total kidney failure.
Okay. In order to be dialyzed, I think you're referring to the fistula or the graft that is being placed on the patient's arm to access the circulatory system for dialysis.
Yes.
What dialysis actually is you actually insert a needle through which you take the blood out of the patient, run it through the dialysis machine, and then another needle is used to return the blood to the patients. So there are two needle sticks at the beginning of dialysis, one to take the blood out of the body, and the other to return it. Now, because of this need, the most effective and efficient way to get that done, both to the patients and the clinic, is to have what we call vascular accesses performed. Vascular accesses are either fistulas or grafts, or in emergency circumstances, catheters. The catheters do the same thing. A catheter is inserted into the vein, a large vein in the chest, and blood is taken out by a part of the catheter, one lumen of the catheter, and blood returned to the other lumen of the catheter to accomplish the same thing. That's the way hemodialysis is performed, and it's critical that those accesses be done on time, because the catheters are prone to increase incidence of infections and more complications.
Well, sir, I ain't sure I understand all them big word, but I know I understand that we have to stay out of that kidney dialysis chair. So, Dr. Gardner, I want to speak specifically to yourself, Christopher Finch, Doc Cook, whoever is involved. We need all of you to negotiate in good faith with a sense of urgency. I don't want to be in a situation where the legislature has to act in an emergency fashion again to address this kidney dialysis issue. It affects everybody in the territory somehow. All of us got a family member that's going through this. So please, let's avert a kidney dialysis. Get this negotiation done in good faith. Dr. Gardner, hearing no more urgent questions from my colleagues, I'll allow you to give yes, Senator Gittins, you're recognized for your burning question. You're recognized for your 4 minutes, Senator Gittins.
Thank you. That sounds more like it. Thank you. I humbly apologize for my tardiness, but good morning to all. I have no questions for you, Dr. Gardner. Okay. You, the patients, and most of the people in this community knows how I feel about this problem. I cannot understand why we can't be a proactive government rather than a reactive government. We have been at this for quite some time, and that's why I special ordered those funds so that we can avert a crisis that was on our hands. Now, you mean to tell me that all this time have elapsed, and yet still we do not see a sense of urgency? It's hurtful. It seems like it will take one of us or somebody for us for things to start moving in a direction that it should go. Sad. We have a golden opportunity before us at this time to expand our medical footprint. Why are we not doing it? I can't understand. I really can't. I continuously heard the chairs saying throughout the hearing here this morning that he had conversations with both CEOs of the hospital, and they're saying that they don't have the capability. Wang Lui Hospital is about to be knocked down. Again, we have a golden opportunity before us. I am going to, again, do my best to reach out to not only the Commissioner of Health, but members of the hospital board, so that we can see a sense of urgency for this, so that you wouldn't be in the next, 1.5, 2 months, find yourself back in this predicament. We should be able to move something. We move what we want to move. Yep. When it's time to jump up and gyrate and do all kind of thing, we find funds to do everything that we want to do. In this case, again, it's a life and death situation. I will say no more because as I sit here and I'm talking to you, I'm biting my tongue to say what I really want to say. But we need to get things moving. We need to be more proactive than so reactive, especially when it comes to things like this. This is a matter of life and death. Thank you. I wish you and the patients the best. And from this end, we will do what we are able to.
Thank you.
My colleagues were all fully supportive once that special order came through, and I thank them for that as well, as they see the urgency of this as well. Thank you, Mr. Chair.
Thank you, Vice Chair Kenneth L. Gittins. And I've just been informed, and I want to announce that the Committee on Health, Hospitals, and Human Services will meet with Christopher Finch this Wednesday, 5:30 at the VI Cardiac Center on St. Croix, so that we could get this moving. Dr. Gardner will allow at this time a 30-second closing statement. You may proceed.
Mr. Chairman, members of the committee, personally, and on behalf of the patients and staff at CKC, we're extremely appreciative of the action you've taken to date, and the action you're taking today, and the sentiments you expressed today. I couldn't agree with you more. I commit to you that I will continue to do everything I can to make sure that the patients, the dialysis patient territory, continue to receive care. However, I need some cooperation, and I'm depending on you to help me accomplish that. Thank you for all you've done, and I hope we can do some more. Thanks.
Thank you very much for your testimony, Dr. Walter Gardner of Caribbean Kidney Center. At this time, the Committee on Health, Hospitals, and Human Services stands in recess for 30 minutes. The Committee on Health, Hospitals, and Human Services is back in session. Mr. Clerk, can you read Block 2 into the record?
The committee will receive an update from the Herbert Gregg Home for the Aged, HGH, on the status of their operation. The St. Thomas East End Medical Center Corporation will provide a follow-up update. The St. Thomas East End Medical Center Corporation will provide a follow-up update operational overview. Invited testifiers, Ms. Dinelle Baptiste, Assistant Commissioner, Department of Human Services, Mr. Alvin Milligan, Acting Administrator, Senior Citizen Affairs, Mistress Anna Valles Martinez, Director, Herbert Gregg Home for the Aged, and Ms. Dr. Tess Richards, Interim Executive Director, St. Thomas East End Medical Center Corporation. That concludes the reading of the agenda, Mr. Chairman.
Thank you, Mr. Clerk. Dr. Tess, we want to do a microphone check, so if you can introduce yourself and also the CEO, so we can have the names on the record and we can test the microphones. And then we'll go over to St. Croix with Ms. Martinez, Ms. Milligan, and Ms. Baptiste to make sure that everything is working. Dr. Tess?
Good afternoon. I am Tess Richards. I'm the Interim Medical Director at St. Thomas East End Medical Center Corporation. And with me is Mr. Stephen Mayers. He's our Chief Financial Officer.
Good afternoon, Mr. Mayers. How are you doing?
Good afternoon, Senator. Good to be here. Thank you.
Thank you. Okay, also on St. Croix, I just wanted to do a live microphone test. Assistant Commissioner Baptiste, can you introduce yourself and we'll test your microphone. You may proceed.
Good afternoon, Janelle Baptiste, Assistant Commissioner, Department of Human Services.
Mr. Milligan.
Good afternoon, Alvin Milligan, Acting Administrator of Senior Citizens Affairs, Department of Human Services.
And Ms. Martinez. We can't hear you, Ms. Martinez. You may proceed. We can't hear you, Ms. Martinez. Okay, media, what we'll do is...
Good afternoon. Can you hear me now?
Yes, we can.
Good afternoon. Ana Velez Martinez, Director of Residential Services, Herbert Gregg Home for the Aged.
Thank you, and we want to give a special welcome to all of the testifiers in Block 2, where we will receive testimony specifically on East End Medical Center and Herbert Gregg Facility for the Aged. Dr. Tess, you may proceed with your testimony at this time.
Okay, good afternoon. Committee on Health, Hospitals, and Human Services Chairman, Honorable Senator Ray Fonseca, members of the 35th Legislature's Committee on Health, Hospitals, and Human Services, other members of the 35th Legislature of the U.S. Virgin Islands, and the viewing and listening public. I am Dr. Tess Richards, the Interim Executive Director at St. Thomas East End Medical Center Corporation, hereafter referred to as STEAM CC. I have with me today Mr. Stephen Mayers, who is our Chief Financial Officer at STEAM CC. First of all, let me say thank you to this committee for giving us the opportunity to present again today. I was on leave at the time of the last hearing, so I sincerely appreciate you inviting us back to give testimony again today. As a follow-up to our last session that was held on June 7th, I'd like to shift the focus of today's testimony to STEAM CC's plan of action. I would also like to review some of the efforts already being made center-wide and some of the changes we have instituted since Mr. Mayers and I took our positions a few months ago. We continue to have significant financial challenges at STEAM CC, but we are working extremely hard to address them and extremely hard to understand them so that this does not ever happen again. You know, in a sense, we are starting from ground zero. There are no quick fixes for the immense challenges that we're facing. So repairing, reorganizing, and restructuring STEAM CC is going to take some time. We know that we have a tremendous amount of work to do, but I can assure you, the staff, the leadership team, and the board of directors are committed to getting STEAM CC on track, and we have already begun some of the steps to do so. At this point, I would like to share some of the efforts our leadership team and corrective action team have instituted thus far as we work towards building a stronger STEAM CC. So, what are we doing? How are we going to get there? Well, one of the first things we did was to evaluate how things were being done in all areas across the center. So we focused on policies and procedures. We started reviewing our policies. If no policy existed, we made a plan to create one. If a policy exists but was not being followed, we started training staff on the policies and have begun to enforce them. We are also reviewing our processes and our procedures. Where there are deficits, we are creating a process and procedure. Because standardizing our processes and procedures across the center will provide guidance for our staff. It will help to delineate their roles and duties, you know, how we want things to be done. And it will give them an idea of our expectations of them within their respective roles. Having processes and procedures in place also serves to support our quality improvement plan by providing a basis for audits, gathering data, and performing our quality metrics. So, we are evaluating the policies, processes, and our flow center-wide, but we are focusing very heavily on the billing and collections department. We need to revamp the entire revenue cycle. And in order to get there, we have to provide support and training to our staff. One of the first things I did when I started just a few months ago was just reach out to the staff, listen to them, talk to them. I would walk department to department just to get a sense of what it is they were feeling and what they were needing. And I still walk the departments, and I still talk to the staff in the trenches regularly to get a sense of what they need. And a majority of what they have said that they need is training. We cannot expect staff to perform if they are not armed with the appropriate tools to do so. And we cannot find out what those tools are if we do not communicate with them. So that's a lot of what we're doing right now, because our staff wants to do well. Our staff wants the center to succeed. But we needed to improve how we were training and supporting our staff. So we're now in the process of providing that training and support. Some of the staff has already started to receive some training, and there is upcoming training that we'll get into in a minute that has been scheduled for the remainder of the staff. The training we are receiving is fiscal technical assistance training from our federal partners at the Health Resources and Services Administration, or HRSA. We began the trainings first with HRSA between managers and supervisors, so we could start from a policy and procedure perspective. The billing and collection staff is scheduled to receive the training next, and then we'll extend that training to all of the staff, because the revenue cycle involves everyone on staff. Everyone has to be a part of improving our financial position. So that is definitely one of our major goals. The more our staff understands about the revenue cycle, the better we are able to function as a team to get where we need to be. So where is that? Where do we need to be as an organization? Number one, let's talk about our financial position. We must improve our financial position. We will always need the support of both the federal and local government just because of the nature of what we do and who we serve. But I would like us to get to a better position where we can sustain ourselves a little bit better. If you look at that first table below, it's called Revenue and Expenses, FY 2019 to 2023 Revenue and Expenses. Okay, so if you look at that table, you can see that STEAM CC had a significant decrease in patient revenue from $6.6 million in FY 2019 to only $3.7 million in FY 2022, excuse me. That change there reflects a decrease in our program income. Our grant income and federal and local allotments have remained fairly constant and consistent, averaging around $5.3 million or so. But the program income, the amount of revenue generated by the center from seeing patients, is what has decreased. And at this point, our program income is only about 46% of our revenue. Our plan is to get back to at least the 53% that we were at back in 2019. So how do we actually accomplish that? You know, how do we increase our program income? Well, there are several things that we need to do. STEAM CC, first of all, we need to try to change our payer mix. In other words, we need to increase the percentage of commercial insurance patients that we see every year. Shifting our payer mix to include a greater percentage of commercial insurers will help to offset the large percentage of uncompensated care that we see every single year. So let's now take a look at that second chart, the pie chart. When you look at our payer mix, it says that we have approximately 10% Medicare, 12.5% or so of commercial insurance, 53% medical assistance, and about 24% self-pay. So only about 12% is private insurance right now, and that's the number that we need to get a little bit higher. Now look at the chart that's called program income. This chart shows the breakdown in our program income. Our program income is approximately 10% commercial insurance, 6% Medicare, 74% medical assistance, but only 10% self-pay. So the 10% self-pay reflected in this chart is the income from those self-pay patients. It's not the percentage of patients that we see that are self-pay. Yes, sir.
Can you just speak a little bit slower so that the stenographer can recall you? Thank you.
Sorry, that's an issue. I always speak very fast, especially when I'm passionate about something. So I will try to speak more slowly.
No problem.
So the 10% self-pay reflected in the chart is the income from our self-pay patients. It is not the percentage of our patients that are self-pay. It is not our payer mix breakdown. That is a key point, because when you look at our payer mix, the percentage of our patients that are actually self-pay is about 25%, 24 to 25%. However, that 24 to 25% of patients who are self-pay represent only 10% of our income. Just to shed some light on this, at STEAM CC, we have a sliding fee discount program to accommodate the patients who are uninsured or underinsured. I will get into more details about that at our budget hearing next week, but essentially, the self-pay patients are offered a deeply discounted rate to ensure that care is affordable, and so that we can bridge that gap in access to care. Because that's why we're here, to make sure that everyone gets care. So the charges are significantly less for the patients who are self-pay and for the patients who are on our sliding fee discount program. To provide you with an example, STEAM CC treated 1,662 self-pay patients last year. So again, 25% of our patients, right? Those patients incurred charges of almost $2.3 million, but STEAM CC only collected $344,000 because those patients were on the sliding fee discount program. So that gap between the $344,000 or so and that $2.3 million was because we had to adjust the patients off. We had to adjust the slide. And there are tremendous gaps like that every single year. The majority of that gap is adjustments because they're on the slide. There is also a portion of that with patients who just don't pay their bills, and that's the piece that we are also working on. To address that piece of it, the poor collections, we have billing and collections procedures, and as I mentioned before, we are currently ensuring that our billing and collections team is properly trained and properly supported on our policies and procedures. That way, we know that our collections can be maximized. We have actually shifted some of our staff into the billing department in an effort to lend more support to billing and collections. By adding these 3 employees to the billing team, we now have a full complement of billing and collection staff in-house, and we are getting them trained to ensure we are doing everything we possibly can to collect our hard-earned dollars. But collections from our self-pay patients continue to be a struggle for us, and we know that that is an issue at pretty much every healthcare facility. And when I said a few minutes ago that we will always need the support of the local and federal government, because of what we do and who we serve, that is exactly what I was referring to. The uncompensated care is why STEAM CC will always need your support. I will spend some time discussing uncompensated care, our sliding fee discount program, our self-pay patients, and more of our budget issues during our budget hearing next week, because uncompensated care is a major contributing factor in our financial struggle. Okay, so thus far, as a part of our plan, we have discussed supporting the staff with training, developing and enforcing policies and procedures. We mentioned that one of our goals is to increase our program income, and that one way is to change our payer mix to offset uncompensated care. The next part of our plan is revenue generation. STEAM CC has to increase the number of revenue generators on staff so we can see more patients and offer more services. We currently have 4 medical providers, 2 behavioral health providers, 2 part-time dentists, and 2 dental hygienists. Unfortunately, as of late next month, we will only have 1 part-time dentist because one is actually scheduled to retire. So our need right now is 3 more medical providers, 1 behavioral health provider, and 2 full-time dentists. Bringing those providers on board would bring us to a total of 7 medical providers, 3 behavioral health providers, and 3 dentists. We had a similar complement of providers prior to the hurricane around 2016 and to 2015, and it worked very well. So STEAM CC needs to get back to that number in order to meet the needs of the community and in order for us to become more financially solvent. So recruiting providers is a huge priority for us at STEAM CC right now. So how do we do that? How do we get providers to come, and how do we get providers to stay? So as far as recruiting is concerned, we have our vacancies posted online on Indeed and some other places. We were using a recruiting agency, but we had to hold off on that because of finances. We realized it just was not feasible anymore. So we are getting very aggressive with checking our postings, aggressively reaching out to everyone we know in the healthcare world. And it's actually working, because as a result of those efforts, we currently have 2 very strong possibilities for the medical team. They have signed offer letters, and so we're hoping they're going to actually come on board. They're going through the credentialing process as we speak, and we anticipate that at least one of them is actually going to start next week, so that's great news for STEAM CC. I also hired 1 full-time dentist who we are expecting at the end of next month. And just for clarification, the 2 medical providers and 1 full-time dentist that are almost on board are part of the need that I mentioned a minute ago. So if the 2 medical providers and that 1 dentist join our team, we will only be short 1 more medical provider. So I tend not to count them until they are fully on board, so I still counted them in our need, okay? So once we have them on board, how do we keep them? Because that's the other issue. That brings us to another challenge, a challenge that is not unique to STEAM CC. How do we not only get providers here, but how do we keep them here? One of the things we are tossing around with our onboarding team is planning small, welcoming events for new providers, for people coming off island, trying to find ways to help them adjust and find their St. Thomas family so they feel we're embracing them and they want to stay. Our hope is by doing that, we don't have people coming and leaving, which is an issue kind of across the territory. But the more pressing issue with getting providers here is that we have to be competitive. Housing is expensive, education is expensive, food is expensive. So when someone looks at the cost of living and they look at the salary, it often just does not make financial sense for them to make the move. For those who come on board, the cost of living is certainly a contributing factor, and sometimes a determining factor in when they decide to leave. But our challenge at STEAM CC is, how do we offer competitive salaries when we are struggling financially and we have a tremendous amount of very old bills to pay? How do we offer competitive salaries when we have a $3 million accounts payable, which ballooned up between FY 2021 and 2023? How do we offer competitive salaries when we just had to lay people off? And let me actually say that here. The decision to cut staff, to lay people off, was the hardest decision that we have ever had to do. It's not something that any of us wanted to do. We agonized over that, but we had to make those hard decisions and have those hard conversations. We had to look at the big picture, which continues to be putting our center in a position to be able to take care of the community. I know that there are likely some questions about the layoffs, why they were done, how they have impacted our center, how we are taking care of the staff that was laid off. So while we are here on the subject of staffing and salaries, let's review what led up to the layoffs, and then we'll go back to how we can ultimately be able to offer some competitive salaries. So I inserted that revenue and expenses table again here so that you can review some of the numbers as we talk about the layoffs. So first, let's look at our payroll. Our payroll increased from almost $5.2 million in FY 2019 to almost $8.1 million in FY 2023. So from FY 2019 to FY 2023, our payroll increased by almost $3 million. Now let's look at patient revenue, which is our program income. In FY 2019, STEAM-CC patient revenue was about $6.6 million, and payroll was only $5.2 million. Something to note here, STEAM-CC payroll was about $1.4 million less than the patient revenue we were generating. So we were spending less than we were making. Now let's fast forward to FY 2023. In FY 2023, our patient revenue was $4.7 million, but the payroll was almost $8.1 million. So what are we noting here? STEAM-CC payroll was about $3.4 million more than the revenue that we generated. So now things shifted, right? We started to spend more than we were actually generating. STEAM-CC revenue dropped from $6.6 million in FY 2019 to $4.7 million in 2023. But the payroll did the opposite. The payroll increased from $5.1 million to almost $8.1 million. So essentially, in fiscal year 2023, we had less revenue and more expenses. So looking at this chart, you see a steady decline in revenue and a steady increase in payroll, specifically between FY21 and FY23, so during our pandemic. But as you know, throughout the pandemic, we remained committed to serving our community, and we remained open. But with physical distancing and safer at home mandates, there was a predictable decline in revenue. We could not see as many patients because people were told to stay home for their safety. We could not see as many patients because people had to acknowledge and abide by physical distancing mandates for their safety. So it came to a point where we were using whatever cash we had on hand to pay payroll. So all of our vendors were either being paid late or just not at all. And because of this exorbitant payroll, all of our financial reserves were ultimately exhausted. Our accounts payable continued to grow, and now it's around $3 million. When I started back in March, it was a struggle to meet payroll every 2 weeks. Do we have money? Is there a check coming in? Somebody call OMB, somebody call finance, literally every 2 weeks, just trying to make payroll. And payroll meant net salaries. That's pretty much what that was. The financial obligations were just not being met. So ultimately, we realized we could not continue with that degree of a payroll burden. We just could not. Just paying the net payroll is not truly paying payroll, and it is certainly not taking care of the employees. This was extremely concerning to me. And one of the first things I did a couple days after I started was I reached out to our federal partners, our local partners, to notify them in great detail about our challenges, our financial crisis, as well as just my overall concerns about things that had been happening at the center. We also reached out to a consultant for his guidance and expertise as we navigated these very dangerous waters for the first 4 to 6 weeks. So based on our financial crisis, our federal partners and our consultant agreed with our initial assessment, which was we needed to decrease the payroll. Initially, we tossed around the thought of doing salary cuts, but that would not have been a significant enough decrease to have made any real impact. There was also a suggestion for us to decrease our work week to decrease the payroll, but that means less patient contact, which means less revenue generation, so that would have just defeated the purpose, which is why we ended up having to do the layoffs. So after agonizing over the thought of staff cuts, we realized that we didn't have very many options, and we certainly did not have very much time to act. So we made the hard choice, and we made the cuts. Okay, so let's talk about the actual layoffs themselves and the direct impact that they have had on our center. The layoffs totaled 18 employees, 6 in the first round, which happened in the beginning of April, and 12 in the second round that happened in June. Right now, our staff stands at 70. The beginning of the year, we had 93 employees. We had 5 resign, and then the 18 layoffs. So that's what brings us down to 70. The decrease in that staff has resulted in almost $60,000 decrease in our biweekly payroll. This has freed up money to start paying some of our vendors. We were able to reopen some of our locked accounts, which allows us to continue services. But our old accounts payable is so large, and we have our usual monthly expenses, of course, so we have not been able to make a huge dent in the accounts payable at all. We are trying as much as we can, but given how old they were and how large that accounts payable is, it's been very challenging to get that all paid down. One of the things that we have done is we have started to pay down the old IRS and IRB bills, because we understand that you cannot take money out of someone's check and not pay their taxes with it. So we are slowly paying down the old bills as much as we can, and we are actually paying the current tax bills along with our payroll since the layoffs. We are only able to do that now because that biweekly payroll is considerably less. Our accounts payable is still a huge burden because there are so many bills dating all the way back to the beginning of 2022, but we are meeting our current financial obligations for our staff. We try to approach our accounts payable by priority, meaning we have to pay the bills that allow us to remain open and to provide services for our patients, but all of our vendors are important to us, and all of them deserve to be paid. STEAM CC wants to be paid for the services we provide, and we desperately want to pay our vendors so we can have the services paid that they provided to us. We also want to take care of the staff that was laid off, and we are paying out their accrued leave to them. Almost all of them have actually received all of their accrued leave payout. The rest of them are getting some payments this week, and we hope to get all of them paid out by the end of this month. So we are actively trying to take care of our staff. So, as I mentioned, we are currently paying our current payroll. We are trying to pay down the accounts payable. We are trying to pay our tax obligations because we realize how critical it is that these accounts become current, and how unfair it was that that was being done to our vendors and to our staff. I mention all of this because of the original discussion about offering competitive salaries. The accounts payable burden is just too much. It's a huge factor in our inability to offer competitive salaries at this point. And as I said, since it's around $3 million, we are in dire need of a cash infusion. As long as we have this long list of outstanding accounts and agitated vendors who have been so very patient and waiting for so very long, we just take whatever revenue we generate and pay payroll, and just a little bit of the vendors, a little bit at a time. There are so many vendors and not enough revenue being generated due to the shortage of providers. We can only pay these vendors a little bit, a little at a time. So we need cash, kind of a jump start to get things going, to get us out of this crisis. We do not have the finances to market ourselves, to recruit, nor to increase our offers to make the salaries more competitive. We need an infusion of cash so that we can clean up our accounts and use the money that we are actually making from the program income to offer competitive salaries, to get more providers on board, and to increase our services and provide even better care to the community, and to increase that program income. So that's the first piece. We need providers to bring in more revenue to the center, and we need that infusion of cash to get us current with our vendors. As we are planning these revenue generation strategies, we are looking ahead towards what we want to do, and we're setting goals for ourselves. We are also looking at where we are right now, and spent quite a bit of time initially looking back to see how we got there. But now our focus is on our future. From this point on, we must ensure that we are capturing every dollar. We must do our part to collect revenue. We must have standards, accountability, expectations, and we must follow policies and procedures. Over the last few months, we have been doing our assessments and evaluations, gathering data, reviewing the numbers, and the team started trying to figure out the story behind why we are where we are financially. We're not focusing on who was involved and any of the decision-making or any of that. We have taken note of that, and we are trying our best to learn from it, but our focus is on the future. We are officially in recovery mode at this point. There are still a lot of questions to be asked, and many answers that we just don't have, but we continue to assess and address our issues daily. Mr. Mayers and I have daily meetings to make sure that we are staying on top of things. Some of the things we have already gotten a handle on, but we do not quite have all of the answers to our questions yet. So what I did was put together some of the questions that we have been asking over the last few months. And I included them in here because I figured if I'm asking those questions, that they may be questions that you all are asking as well. 1, why are our revenues so low? So typically, we're bringing in around $200,000 per month at this point from all of our payers combined. And we touched on why that's low. 1 is the payer mix, and 2, the lack of revenue generators, which is a huge challenge for us. But we are addressing that by actively recruiting. And like I mentioned, if everything goes as planned, we will have 3 new providers on by the end of next month. We are also training our billers and instituting quality metrics to ensure that clean claims are submitted, and providing documentation and coding tidbits to our providers to capture as much of our revenue as we can. Number 2. What's your turnaround time to get the claims out? So claims are submitted every single day. Pretty much every claim is submitted within 48 hours. Some are actually submitted the same day of service. Number 3, what's the turnaround time per payer? So commercial assurance is typically about 30 days. Medical assistance is closer to 3 months. The actual claim is processed fairly quickly by medical assistance, but it takes some time for the checks to get to us from the Office of Management and Budget and or from Department of Finance, because both of those departments have a tremendous amount on their plate as well. Number 4, what do we do to collect from our self-pay patients? So we provide financial counseling to our self-pay patients. We create a payment plan for all of our patients who have outstanding bills, and we are considering developing an amnesty program to try to maximize our collections. And again, training is all a part of this. Number 5, are we enrolling patients in our presumptive eligibility? Yes, every patient who does not have sufficient insurance and does not currently have medical assistance is evaluated for their eligibility. Our staff underwent a training in the end of June 20th and 21st, to learn more about the presumptive eligibility expansion. And as a matter of fact, I was told by our staff that they enrolled 2 patients in 2 days last week. So it is actually actively working, and we are enrolling patients. Number 6, what do we do about rejected claims, and what is the turnaround time for addressing and resubmitting a rejected claim? This is an area that needs improvement. We are seeing that there have been rejected claims that were not completely addressed, and we think that the addition of the 3 staff members to the billing team will help to address those old rejected claims. The CFO will perform routine audits on the timeliness of claims, the turnaround time for rejected claims, and the payment rate for rejected claims that have been resubmitted so that this doesn't happen again. What quality metrics are in place? So historically, not very much quality was being done in the business office consistently. So we are in the process of implementing a strong quality improvement plan with the business office. The metrics we will be looking at are all the things we kind of discussed in questions 1 through 6. Number 8, what is STEAM CC doing to improve its financial position? So we created a corrective action team that has been developing strategies to overcome the many, many challenges we have been facing. We created cost-cutting and cost-savings plans, which include 1, fine-tuning our procurement process, making sure that the things we're buying are things we actually need and can actually afford, and that we are getting them at the best prices. 2, creating utilization tracking processes across the center to evaluate our current practices. How much of each supply does each department use? This can give us an idea of overuse or wasting of supplies. 3, limiting access to who can use the credit card. 4, reevaluating all of our contracts with our vendors to ensure that we are getting the best service for the best price. 5, insourcing for services rather than outsourcing wherever we can. 6, negotiating to decrease our footprint within the mall so we can decrease our monthly rent, which is about $70,000. Negotiating to terminate our land lease, so we are trying to do that as well. And focusing heavily on all aspects of billing and collections. Having done at least the initial steps of evaluating our billing and collections department, we definitely saw some gaps within the business office. As a result, like I mentioned, we asked our federal partners to do an overall fiscal analysis to get an expert assessment of the whole department. The other request from the federal government was the fiscal assistance training that I mentioned. And the purpose of these trainings is to ensure that our staff knows how to improve collections. Improving collections is critical because that piece of improving the revenue generation, that's on us. Collections is the piece that we have to address to ensure that we are not only asking for help from external sources, but that we are helping ourselves as well. Ultimately, improving those internal processes, particularly our billing and collections, will make us a much stronger center. And so this is the part that I'm excited about, expanding our services. That's another means of improving our revenue generation. Our goal is to bring on more providers for primary care, as we mentioned, but we are also in talks with a few specialists. We're planning to bring on a part-time gynecologist next month who will focus on the patients who need surgery. And she can actually do some outpatient, non-invasive procedures right in the center. We are also talking to another specialist. I cannot disclose more now because it is the only specialist of that type on the island. And until things are finalized, I'll just say a specialist. But the exciting part of that is having that specialist will increase the number of patients with commercial insurance visiting our center. We can even have specialty days for that provider. We used to do that back in 2012, 2013, where we would have cancer screening days, breast cancer, prostate cancer, pap smears. So if we are able to bring the specialist on, we can host those specialty days again for that specialty. Perhaps a Saturday, where we focus just on that specialty and really promote it heavily to our patients and the entire community. Again, another means of revenue generation. Outreach, we are working on rebranding with our team. We actually do quite a bit of outreach, but the staff reports that that too has become a challenge because of finances. But outreach is essential. There are still so many people who do not have a medical home and who do not have a primary care provider. Outreach provides education and an opportunity to bring people into care. Ideally, once we have that funding, we want to have an outreach van to go into the communities and provide services. We'd like to partner with the Department of Education as well to be able to go into the schools and provide health education and screenings to both the students and the staff. Nutrition. Again, once we have funding, I would like to bring a nutritionist on board to provide education to our patients. We can offer both individual and group sessions for our community. And we can create sessions for our patients living with hypertension, high blood pressure, and living with diabetes. We would also like to develop an obesity program for adults and for children. Behavioral health expansion. Ultimately, we would like to bring on another behavioral health provider. However, in the short term, we are already planning behavioral health expansion. Our behavioral health team is very passionate about educating the public on mental health. They are actively in the process of developing a program to go into the government agencies, schools, and long-term facilities to provide care. They have already reached out to some of the long-term facilities and to the Department of Education, and the leaders at both places are very excited to partner with us to ensure the mental well-being of their patients, their staff, and their students. We will also like to reach out to the government agencies to offer services for individual sessions and group sessions as well. We are hoping to create great partnerships with these entities, as these partnerships will serve dual purposes. They will provide much needed mental health support for our community and will be a source of revenue generation for the center. Our hours of operation. Once we have enough staff on board to support this, we will begin to offer extended hours to reach a much wider audience. We can potentially do Saturdays, a few per month or a few per quarter, depending on demand. During the week, we can open early or we can stay open late for the person who wants to get a physical before they go to school, or the person who needs to stop by after work to get their prescriptions refilled. Because increasing access is such an important part
Dr.
of
Tess,
providing care. Yes.
Can you just slow down a little bit?
Again,
So,
I'm
yes.
sorry.
Thank you. You may proceed.
Increasing access is such an important part of providing care, and I definitely want us to expand our hours of operation. Our 340B program. Another goal is to really get our 340B program off the ground. The 340B program is a discount pharmacy program available for facilities who serve the underserved. The 340B program has existed at the center since 2020, but it was not generating any revenue and was not really being pushed. We now have a dedicated 340B lead who is in constant contact with our 340B managing partners. We were able to add a local pharmacy and an online pharmacy, so we now have 3 pharmacies that participate in the program with us. We are happy to share that we are in talks with 2 more local pharmacies. Our goal is to have participating pharmacies all across the island, as well as on St. John, for the convenience of our patients. Again, this will serve dual purposes. The participants in the 340B program can get some of their medications at a deeply discounted rate, and it's a source of revenue generation for the center. Other new funding sources. The last thing we are trying to do for revenue generation is to get a bit more aggressive and creative about finding funding sources. We are working on developing a grant team to seek out, write, and manage our grants. We spoke with our project officer last week about providing assistance with this piece, and we formed an MOU with the Primary Care Association of Puerto Rico, who will help us with grant writing and acquisition. Aside from the many reasons already discussed, we also need new funding sources to improve our IT. Basics like a phone tree and a patient portal, new computers, and new scanners can all help us with decreasing data entry errors on patient demographics, cutting down times that patients wait, because check-in would be electronic and patient information would be entered by the patient rather than by the staff. It would help to free up call center staff from answering phones so they can be placed elsewhere, thereby increasing productivity. Leveraging technology within STEAM-CC will ultimately improve patient education, make patient medical records more accessible, and accessible not just to the patient, but to the healthcare entities in the territory and nationwide. So for other sources of funding, aside from grants, we are also trying to get a foundation off the ground at some point to help us with fundraising. There are many people within the territory and nationwide with the means to lend assistance to STEAM-CC. Having a community like ours begin supporting us financially with either direct cash infusions or equipment donations would contribute greatly to our cause. So we are working on securing that piece as well. Finally, our other goals. Collaboration. We want to continue to collaborate with our healthcare partners at the Department of Health, Schneider Regional Medical Center, and our sister clinic, Frederickstead Healthcare in St. Croix. We have already collaborated with the DOH for outreach and educational sessions in the past, and we have some ideas that we are tossing around together about outreach collaborations in the future. Frederickstead Health Clinic has always been very supportive, and we are collaborating with them on an HIV program right now. I would like to continue to collaborate with the DOH and FHC, and I would like to begin more collaborations with SRMC as well. I hope to do more team building. I am a firm believer in collaborating and forming partnerships. The more we do together, the better we serve the community, especially given our limited resources territory-wide. The last thing is education. We continue to provide support and education for students in the healthcare arena, even at this point. Despite our challenges and shortage of providers, we realize how important it is to support people who have a career aspiration in healthcare. We are always especially proud to host our locals who may ultimately return to the center for employment upon completion of their education. We have had several CMAs that start as CMA students, come to work for us at CMAs, and then stay a few years before they go on to become RNs and then come back. We also have a nurse practitioner right now who has been with us for 3 years that came here as a nurse practitioner student. So it is important for us, despite our challenges, to continue to say yes. This year, we have also been providing clinical training for hours for UVI nurses, a clinical social worker student, and physician assistant students from Marist College. We certainly want to continue to be able to provide these educational opportunities. So, despite all the challenges and the setbacks we have been experiencing recently, I have definitely started to see improvements in the center from a financial standpoint and from a productivity standpoint. And oddly enough, despite the layoffs, there has even been an improvement in employee morale. Of course, initially the layoffs were unnerving and caused a certain amount of angst amongst the staff. But at this point, there is less tension, less stress, less disgruntled and dissatisfied employees. We have less call-outs, and we have distributed employee surveys so we can gather real data, not just the anecdotal stuff that I'm mentioning now, but real hard data about employee satisfaction. Once those surveys are returned, we can begin the improvements wherever necessary. But the changes have started. One employee actually said to me, unsolicited, I didn't ask her how she felt, she just came up to me and said, "It feels like someone's actually listening now." Another one said to me, "It just feels so much lighter in here, Dr. Richards. The staff finally feels like we can breathe." So I know things are already starting to turn around. We just need a little bit more support. We are working tirelessly to rebuild our team at STEAM CC because STEAM CC is going to rock. We're going to thrive again. The staff we have right now is awesome. They're dedicated. They're working hard. So we're going to get there. We just need a little bit of a cash infusion to get there. So I'd like to thank Governor Bryan for his support and for his team, Ms. Tasha Phillips-Dorset, Director O'Neill, Mr. Creaky and Ms. Hobson at OMB, Ms. Henneman at the Lieutenant Governor's Office, Ms. Reed at the DOL. We have had to reach out to so many government agencies for help, guidance, patience, and they have all been very, very helpful, but the people I just mentioned have been especially helpful. Mr. Wilbur Smith has been wonderful, mentoring, listening, guiding. And I have to mention Ms. Tasha Dorset again, please. She is an incredible asset. She has been a wonderful advocate for all of us in healthcare. So thank you, thank you, thank you for all that you've done for STEAM CC so far. And to this body, thank you. I express my appreciation again for affording us the opportunity to present an update on our status. Thank you.
Well, thank you very much for that detailed testimony, Dr. Tess. It's very, very encouraging, and I can see that there's been tremendous improvement at STEM CC.
And I'm sorry, Ms. Senator Fonseca, may I say one more thing that I neglected to say?
Yes.
Thank you, staff. The 70 people at STEAM CC are awesome. Thank you, thank you, thank you.
Yes, staff are always the backbone.
Always the best.
Yes. At this time, Ms. Danelle Baptiste, Assistant Commissioner of Human Services, you may present your testimony to the Committee on Health, Hospitals, and Human Services. We can't hear you on the mic.
Good day.
Proceed.
Good day, Honorable Senator Ray Fonseca, Chairman of the Committee on Health, Hospitals, and Human Services, committee members, other senators present, and to the listening and viewing audience. I am Danelle Baptiste, Assistant Commissioner of the Virgin Islands Department of Human Services. Here on behalf of Commissioner Kimberly Causey Gomez, as she attends the Governor's Cabinet meeting. Joining me today is Mr. Alvin Milligan, Acting Administrator of the Division of Senior Citizen Affairs, and Ms. Ana Velez-Martinez, Director of Residential Services for the Herbert Gregg Home for the Aged. We appear before you today pursuant to your invitation to provide testimony on the status of the Herbert Gregg Home for the Aged. The Division of Senior Citizen Affairs currently oversees 11 programs dedicated to supporting the elderly community in the U.S. Virgin Islands. This includes 2 homes for the aged, are 24-hour senior residential facilities. The Homes for the Aged provides quality residential health care to senior citizens aged 60 and over in a caring setting, respecting the individual's right to independence, dignity, and choice. Services include medical, nursing, and custodial care, as well as therapeutic recreational activities designed to help residents remain active and self-sufficient. At the Herbert Gregg Home for the Aged, there are currently 22 residents in our care with a waiting list of 23 individuals. We are happy to share that with the addition of new staff members, we will be admitting 3 additional residents by the first week of August 2023. One of these individuals come from a population commonly referred to as boarders from the Governor Wang F. Louis Hospital. Boarders in this instance refers to individuals who are accepted into our territory's hospitals who are now unable to be safely discharged as they would not be able to care for themselves otherwise. While seniors are not the only makeup of this population, they represent a large percentage and are indicative of the widely recognized need for sufficient long-term residential care for a growing population of seniors. A need that remains at the forefront for the staff and leadership at DHS, and which guides the current work we do and the plans that we are developing and putting into action. Services and staffing. With a total of 48 employees comprehensively, there are 5 primary units that operate effectively in carrying out the daily functions of the homes. They include the following: dietary, with a total of 9 staff members. This unit includes the kitchen's operations and ensures that our residents are provided with daily meals and snacks that are high quality and meet the nutritional needs of our residents set forth by the nutritionist. Staff in this unit includes 1 kitchen manager, 3 cooks, and 5 food service workers. Nursing and medical, with a total of 27 staff members. The nursing and medical staff at HGH help with daily living activities, monitoring vital signs, medication administration, and medical assessments and treatment, among many other tasks and duties. Staff in this unit includes 1 registered nurse, 8 licensed practical nurses, LPNs, 16 certified nursing assistants, CNAs, and 2 nursing assistants. The department onboarded 3 new CNAs in the last week and will onboard 1 additional CNA by the end of August. In addition to our capable nursing staff, 2 physicians provide contractual on-site medical services to the residents. We currently have 1 vacant RN position and 2 vacant LPN positions. Institutional support, with a total of 9 staff members. This unit is responsible for all the support services needed to maintain a clean, quality, and safe environment, as well as experiences for the residents. Staff in this unit includes 1 institutional supervisor, 4 institutional attendants, and 4 laundry workers. Other roles in this unit include a senior aide chauffeur and maintenance workers, of which there are none on staff currently. We have 1 vacancy for an institutional attendant. Social services. Our social workers and social service aides work alongside our medical staff to care for our residents holistically, focusing strongly on their social and emotional welfare. HGH does not currently have any social workers or social service aides on board, but works very closely with the Adult Protective Services unit where possible, and especially during the onboarding process, to ensure the residents' total well-being is regarded and cared for. Administrative, with a total of 3 staff members. This unit is responsible for the overall operations of the facility, especially all administrative functions. Staff in this unit includes 1 director, 1 administrative assistant, and 1 office manager. In addition to our regular staff members, we also have 1 Senior Community Service Employment Program worker, CSEP, that aids the whole. DHS is not unique in its challenges regarding difficulties to attract, hire, and retain quality talent in general, but more specifically in the healthcare profession. Currently, the department is confronted with recruiting and retaining nursing staff, in addition to other roles, due to the relatively low salaries of those unionized positions, especially when compared to recently increased salaries at the territory's hospitals. This is an identified gap that the department is working closely with Governor Albert Ryan Jr. and his team to address. In caring for our employees, the leadership at HGH works hard to motivate and increase the morale of staff through staff engagement activities and ensuring that their concerns are heard during regular staff check-ins. Furthermore, the department is working to address any identified staff concerns to the best of our ability. Facilities. HGH operates out of 3 primary buildings within a large compound owned by the Department of Human Services on the island of St. Croix. These facilities are very dated, and combined with the damage experienced during Hurricane Maria in 2017, has provided difficulty in maintaining the facility. Currently, there are needed repairs to the facilities to include roof repairs in the kitchen, storage, and common area spaces to prevent leaks caused by heavy rain, plumbing and electrical work to ensure that all areas and equipment within the facility are operating efficiently, repairs to window screens which were damaged severely after the storms and which have more recently created additional physical plant challenges, and repairs to and replacement of air conditioning units throughout the facility. In addition, to support the operations and maintenance of the facilities and grounds, the department is also in need of a new generator for the home's kitchen to effectively carry out operations during power outages, and a zero-turn lawnmower to maintain the expansive grounds of the facility. The department is in the process of prioritizing these repairs and needs and is gathering quotes from various vendors for the services needed. Disaster recovery. DHS is excited for the anticipated obligation of approximately $129.6 million for the permanent replacement of Herbert Gregg Home, which will expand the current census capacity. The team is actively working to move these projects forward in conjunction with the Office of Disaster Recovery and to accelerate our ability to establish new facilities that will increase our capacity and remove the ongoing facility challenges that are, among other things, time-consuming. FEMA's approval of this project allows for the establishment of a new facility that caters to skilled nursing needs and incorporates state-of-the-art physical and occupational therapy for our senior population. Additional challenges. As previously mentioned, the department recognizes that there is a growing need for long-term 24-hour care for our seniors, a need that currently surpasses the capacity and resources of the department. Even with some extra physical spaces available for additional residents at HGH, there are several resources that would be needed to care for an increased census. Additional needs and considerations include sufficient staff in all 5 units to meet the required staff and resident ratios, food, kitchen equipment and kitchen supplies, cleaning supplies, laundry equipment and supplies, vehicles, drivers and maintenance of vehicles, medication to include prescription and over-the-counter medication, medical equipment and supplies such as beds, wheelchairs, walkers, diagnostic and evaluation tools, disposable undergarments, blood pressure testing kits, glucose testing kits, bandages, bed chucks and pads, masks, disposable gloves, etc. Medical waste and other solid waste disposal services, and maintenance supplies. Given that HGH is not certified by the Centers for Medicare and Medicaid Services, CMS, which would make it eligible for Medicaid funding, nor does it qualify for any other federal funding received by the department. It is 100% funded by the government of the Virgin Islands through the general fund. As a result, the department is only able to provide finite services based on the resources available. With a full prudent replacement on the horizon, DHS will be able to seek CMS certification for both homes and be reimbursed by the Medicaid program for eligible Medicaid residents. This will be a major step in providing adequate resources to continuously maintaining the new facility and any pertinent equipment. In closing, the Department of Human Services works diligently every day to carry out its mission with the resources that are available. The hardworking staff at Herbert Gregg Home for the Aged work tirelessly to provide the highest level of care for our residents that reflects the level of care they would give their own family members. I would like to publicly thank our staff for their unwavering dedication and continued commitment, as well as Governor Bryan and Lieutenant Governor Roach for their continued support of the department. We would also like to thank our gracious community partners, such as the St. Croix Lions Club, the Rotary Clubs of St. Croix, the Friedenstahl Moravian Church, and the VI Department of Education through their USDA Emergency Food Assistance Program for their generous donations of money, supplies, and food throughout the years. This concludes our presentation, and the DHS team and I remain available to answer any questions you may have regarding our testimony today.
Yes, thank you very much, Assistant Commissioner Dinell Baptiste, for that enlightened testimony. I want to begin this round by just letting the people from STEM CC here today to let you know that if there's any particular question that we ask you that will interfere with any investigation, just let us know real quickly. Because you see, as a senator, when I here walking and I doing my job, getting to the bottom of these issues, I have immunity from prosecution, so nobody can threaten me, say they're going to put me in jail, because you can't put me in jail. That's the law. I am doing my work. SEMCC had some issues where 18 people have been laid off, and I can tell you here today, I am so impressed with, what STEM-CC has done in the last few months since we have last spoken. I have to congratulate the governor. Accolades to Miss Jennifer O'Neill from OMB, and also Miss Tasha Dorset Phillips. Thank you for all that you have done for STEM-CC, STEAM-CC to assist this organization, because, thousands of patients are being seen out there, and we made sure, this committee made sure that organization would not close, because we could not in no scenario allow STEM-CC to be able to close. So, colleagues, we're going to go to a round of 5 minutes, and Senator Marvin Blyden, you're recognized for your 5 minutes.
Thank you so much, Mr. Chair. Good afternoon, colleagues. Good afternoon again to the viewing and listening audiences. Good afternoon to Dr. Tess, CFO Mayors, Assistant Commissioner Baptiste, and I am testimony. Richard. Oh, Dr. Richard, I'm sorry, I apologize.
That's okay.
I'm a little concerned, a lot concerned, really. Before I ask my question, though, Mr. CFO Mayors, I need from you in respect to the employees that were laid off. I need you to provide, through the chair, a listing of the persons hired and terminated, those who resigned between 2019 and the present, and also can you indicate the amount of program income that was derived from the areas in which those individuals worked. Okay, I'll appreciate that. And, you know, being here over the last 8+ years, 9 years, you know, STEM CC and Frederiksted Health Clinic, Health Center has come in front of us time and time again, and there are 2 federally qualified healthcare facilities, and they do not do things in separate universe, they do things alike. And to hear today with the testimony in respect to COVID being one of the main reasons that have affected the funding, etc. And I honestly, just being honest, I don't see that because Frederiksted Health Center and other institutions have done well during that time with all the federal fund, the amount of funding that was available and all the other perks during that time. So I have a question in that respect, honestly, because in your testimony you also spoke. Someone mic it on, please. Put your mic on mute. In your testimony, you also spoke in respect to program income, and specifically you spoke to the time frame between 19 and 23, and we saw a $3.6 million, increase. I must say that's a lot. And when it comes to payroll, my question is in respect to payroll and revenue. When it comes to the revenue income, how did you go about determining who gets laid off versus which department brings in the revenues? How did you balance that scale? Can you explain that to me?
Sure. Thank you for the question. So just for point of clarification, it wasn't, thank you, it wasn't COVID
1 minute.
that would have caused the decline in the revenue. The problem was we know we could only see limited people because people were staying home, and during that time, payroll increased. So it wasn't because of COVID, it was because of the payroll increases during a pandemic where we know we can't see as many people. So that was the first one. The second thing is, yes, it was difficult to determine who. Everybody, every employee is important to us, but we had to go with the people that are the most critical to direct revenue generation. So no one from clinical, because they directly help with revenue generation. And then we didn't do billers because they help directly with revenue generation.
Okay, and how are you dealing with, as a result of your current situation, how are you dealing with the vendors, outstanding vendor payments? Can you explain to me what the plan to deal with our vendors, because they play a critical role also, and they are being affected
Time.
also. So how are you going about dealing with that situation?
So literally every day we are on the phone with vendors, we are emailing our vendors. A lot of them just hearing from us are kind of accepting of our situation because we're communicating with them, and that has made a tremendous amount of difference in their frustration. But as we get money in, we do the same thing we did with the staff. Okay, who do we have to pay in order to stay open? We have prioritized things in that respect. So clinical suppliers, we must pay. Our electronic medical records system, we must pay. So that's how we're kind of doing it. When we get any extra, we pay the other vendors little by little.
Okay, and in closing, Mr. Chair, I guess in the second round, I'd like to hear more about your restructuring and also your program when it comes to the technical assistance from the feds. So I appreciate your responses. Thank you so much, Mr. Chair, for the time.
Yes, thank you, Senator Blyden. And to follow up on that, I also echo the same sentiments that I think it was a total of 18 that was laid off. I'd like to see all of them people get a job back. But I want to point out in your revenue generation portion, right, which is very important, that you now need 3 medical providers, 1 behavioral health specialist. You see, that's important because, this legislature has passed a behavioral health bill. And I'm glad to see that you're giving that attention, and also 2 full-time dentists. So let me ask you, your budget that is going to come before the legislature, did you prepare that budget, or was your predecessor responsible for preparing the budget?
Neither Mr. Mayers nor I were involved in the preparation of the budget. The budget was prepared before we began in March and April, respectively. So no, we did not participate in the preparation of the budget.
Okay, thank you very much. Next, we'll go to our Honorable Senate President, Novell E. Francis, Jr. You're recognized for 5 minutes, Mr. President.
Thank you very much, Mr. Chair, and good afternoon to the STEAM CC as well as to Herbert Gregg, Department of Human Services. Dr. Richards, I realize that you have been placed in the hot seat in regards to being the interim CEO at STEAM CC. Is there any plans, or are you being considered for the permanent position? What's happening in that space in regards to filling that position?
So thank you for that question. That's probably a question on lots of people's minds. What HRSA usually recommends when we are in an interim period and in crisis is that we get to a position of being somewhat stable before bringing on someone new. So that's what the board is doing right now, trying to get us as stable as we can and then bringing on someone to be the permanent ED.
Very well. And in respect to the 18 individuals that have since been laid off, are you stabilized now? Is there more to be laid off, or what's happening in that area?
We do not have any immediate plans to lay anyone off right now. We're hoping to not have to do that again. We are certainly in a much better position now than we were before. So again, I'm hoping that we don't have to do any more. We do not have any direct plans right at this moment.
And in respect to the layoff of these individuals, was time in service a consideration? Were there any discussion about placement elsewhere? Obviously, quality health care is an issue, throughout nationwide. And certainly, have there been any discussion with Snyder Hospital or any other facilities in terms of being able to transition these individuals to before resorting to the option of layoff?
No, we did not, but that's actually a good suggestion. So thank you for that.
Yeah, please let's visit that. We're our brother's keeper and brothers and sisters keeper, and certainly, we're one government. There's places in human services, all over Department of Health. Right. Certainly medical and quality health care is certainly an issue throughout, and maybe we could go back and take a look at that.
Yeah, thank you for that.
Okay, you're welcome. You're welcome. In respect to, of course, I too, I'm the mover, primary sponsor on the behavioral health bill, and that's very near and dear to me. And also, I'm happy to see that there is some effort being made to address your behavioral health, and dental is also equally important because oral health is overall good health. Let me go real quickly to human services, and over at Herbert Gregg Home, Ms. Martinez, ¿cómo está? How are you?
Hi, good afternoon, Senator.
So what's going on over at Herbert Gregg? Obviously, we have some challenges there. Making sure that individuals eat. We're hearing about generator issues and stuff like that. What's happening over at Herbert Gregg that requires some immediate attention as we speak?
Senator Francis, thank you for asking that question. The kitchen needs a generator. We have no generator in the kitchen at this moment, so that is really a critical item that we need.
And that's specifically for the kitchen? We have generators for all the other buildings?
Yes, we have a unit that actually covers the nursing and the other buildings.
What about the food pantry? Is it stocked and ready to go?
We have some food right now, but our funding still is not enough for the type of service and the menu that we provide. Plus, also, we need a 0-ton. I am asking you, I know you were supposed to donate one, so I'm taking a moment of asking that question.
Yeah, there's one earmark. We are working with Home Depot and a vendor to provide the. I already have half of the payment, a check sitting on, and I'm just waiting for the presentation to Home Depot so that you could be able to get that 0-turn more. But besides the more, what about medical supplies, medication, and everything else? And where are we with that?
Senator, like I said, when I also, our budget, when we get our budget and annual, we receive about $8,300 on a monthly base. Based on the needs and the essential uses, we don't have enough funding to cover our medical or food or the facility needs at this point. I know we've been working with the CFO to find funding in-house, but at this moment, like I said, funding, it's not enough for the type of service that we provide.
Time.
So based on, Mr. Chair, if I could just wrap up real quickly.
Yes.
Based on the budget that we receive, we're very much concerned that the $8,333.33 is earmarked on a monthly basis for medical supplies. Do you consider sufficient to be able to procure all of the medication that's required for our seniors?
It is not sufficient. When we do our essential uses, we need additional $200,000 just for medical.
Very okay. I know my time has been called, but I'm hoping that my other colleagues could drill down on this issue because, of course, medical supplies is critical to your continued existence over at the Herbert Gregg home. Thank you very much, Mr. Chair, for the leniency and time.
Yes. Point of information, Senator Marvin Blyden. You may proceed.
Thank you so much. Mr. Mayor, CFO Mayors, let me ask you in respect to income during the pandemic. Federal grant, do you know how much was received during a period? Federal grant was received during a period to assist when it comes to patients?
Thank you very much.
Income?
Regarding our grants numbers, for the most part during the pandemic, which is 2001, 2000.
Not one.
There's 2000?
No, not 2001.
21. Not 2000.
Oh, sorry, my apologies. 2021 and 2022. You will note from the schedule that was provided during the presentation of Dr. Richards that we had a significant amount of funds coming in for grants. A lot of those, a large proportion of that was related to specifically to the pandemic. We also.
And what were they for? Were they to assist with patient income? That's what I'm getting at. Were they to adjust toward patient income because of the pandemic?
I can't answer that question to you exactly right now. I know that one of the things that we got was part of that was a $1.8 million that we got as a I'm not sure how to describe it, from Medicaid, sort of back payment, so to speak, for several years, and that was $1.8 million. I think that those funds in particular appear to have been used for some salary increases that resulted in that $8 million that we're dealing with at this time. But we also got several different grants that were specific to assisting us during those periods, but I can't give you the exact number right now.
Okay, through the chair, if you can provide that, we'll appreciate it. Thank you so much.
Yes, thank you, Senator Blyden. And Mr. Majors, I just wanted to follow up on that because you gotta give credit where credit is due. And I know the governor and OMB director and Tasha Dorset have been very, very instrumental in helping you. So can you give us a detail of what additional money the government was able to provide you to avert any more layoffs? Specifically, I think it was ARPA grants Give us the detail of what you received.
Thank you for that question, Chair. Chair, earlier in my tenure here, which was about 2 months ago, Dr. Richards and including members of the board as well reached out to the governor through Ms. Stacia Dossett Phillips, and we were able to secure, or this government agreed, with the help of OMB Director O'Neill, to provide us with a $2 million APA grant from the APA funds. Initially, they provided us with $500,000 of that $2 million, which we got sometime in June, and we got another $500,000 just last week. So we've gotten about half of those funds, and we expect to get the other half within the next several months. So we are quite happy with that. Those funds were used specifically to reduce the amount of accounts payable that we had in our books. When we were here last time, our accounts payable was somewhere close to about $2.8 million. I want you to keep in mind as well that while we're reducing that, there are new additions to it. So at this particular juncture, the number that Dr. Richards called of $3 million is about where we are right now.
Thank you very much. Senator Diane T. Capot, you're recognized for your 5 minutes.
Good afternoon. Thank you, Mr. Chair, and good afternoon, Dr. Richards and your team. Good afternoon, DHS and your team. I really don't have many questions for the St. Thomas East End Medical Center, other than to say that you acquired a few challenges as you took over the helm of this medical center. And based on your testimony today, I would say that you've made some improvements for sure from the financial and productivity standpoint. I would say that we'll give you a few months to see how that goes, and hopefully that you'll come back again to talk about if there are still challenges that you face. But one question I do have as it pertains to Medicaid, you referenced that you two take advantage of presumptive eligibility, and based on your chart, you have a large percentage of individuals that you serve. 74% of your income comes from Medicaid. And you mentioned that since you started, you've only certified two individuals for presumptive eligibility. I would just make sure you suggest that presumptive eligibility would help a lot with your uncompensated care. Make sure that your staff is trained so you don't lose any of that funding that you can get from Medicaid. And your waste disposal, who gets rid of your disposal of waste?
So, first, I want to just clarify something, Senator. The two presumptive eligibilities were not since I came on. I was just saying that we had 2 in 2 days in the last week, so that we were just excited that they had actually started to really pick up since getting their training in June. So we've had a little bit more than that. It's not a tremendous amount, so absolutely thank you for that suggestion of pushing the presumptive eligibility, but that too was not for the entire time, just last week.
Okay,
yeah.
Well, that's good.
Yeah.
For last week, okay.
Yeah, so thank you for that piece. Waste management, we don't have a tremendous amount of waste, as you would have from like a hospital or a center where we have bodily fluids and things like that to any degree. But we do have a contract with someone that's at the hospital that we deliver our red bags to, and we have an incinerator where that's taken care of from them.
Medical waste is what
Correct.
I was
medical
referring.
waste. Mm-hmm. Medical waste. Correct.
Okay. Well, I wish you the best.
Thank you.
I love your energy. I think it's important when a leader comes into someplace where the morale was low, there were a lot of challenges. I know you had to make some tough decisions. But one, I don't know if my colleagues asked, how did you determine who would be the individuals, the employees that you laid off? Did you hire based on the last hired first to fire?
1 minute.
No, we did not, because that may have actually been someone who was a revenue generator. So we did not do it that way. What we had to do was go through our staff and see the people that are directly involved in either generating revenue or capturing revenue. And those people were definitely off the list. And the people who were least involved in that were the people that we considered for termination.
Okay, thank you so much.
Thank you.
DHS, I have to give praise to Ms. Martinez. I have to say that you make the best out of what you have. And you try to work with your staff and whatever resources that you have, you try to make your residents as comfortable as they can. I know you have some challenges with that generator for the kitchen. I've had the opportunity to visit Herbert Gregg myself and see the facility, and even to do a comparison with St. Thomas, Queen Louise to St. Croix. And of course, there are improvements to be made. But I can't say that the quality of care that these individuals that work under whatever conditions, that they do their best for people who need that assistance. I just want to also say that I wish your commissioner of DHS was here, because the newly appointed assistant commissioner may not be able to answer a lot of questions I may have. So I think, Mr. Chair, I would patiently wait, even if it's for a budget meeting, to really drill down in some of the real issues that is happening at the Department of Human Services. I don't know if Mr. Milligan is there. I also want to give you your praise for all that you do. And I know the facilities for the seniors may not be centrally located, but I know the quality of care, again, that these individuals, Mr. Milligan, Ms. Martinez, that offer at DHS. I just want to say I appreciate you guys, because I won't even talk about my personal experience that these individuals helped me with my 100-year-old uncle, who is now in Queen Louise facility in St. Thomas. Mr. Chair, thank you very much.
Thank you, Senator Capehart. I want to quickly go over that, right? Because while my math ain't too good, I know a little bit of math. So it's so interesting, Assistant Commissioner Baptiste, that you mentioned that the medical supplies was $8,333 per month. And the president of the legislature just questioned you about that. So that means I have the actual budget here in front of me. And I want to go to the food, because you see, the vice chair of this committee from St. Croix and I, and the senator from St. Thomas, we actually went in there and saw that walk-in freezer pooper. So listen, you have here $3,750 a month for food. Your testimony here on page 2 is telling me you have 22 residents. So when you divide that, that comes to $170. That means for 22 residents, you have $170 per month per resident. When you divide that by 30 days in a month, you get $5.60. Listen, $5 $5.60 is what you have in the budget to feed 22 elderly residents, plus you tell me you're giving them a snack. That's why that freezer is empty. This is totally unacceptable. How could you feed 22 residents for $5.60? And hear this, they got cloth and clothing. So I imagine that's Pampers and thing, right? Because the people them that I saw, those residents, most of them were not where they can move around. Doing the math, it come out to 63 cents a day. How in the world Human Services can provide Pampers and things for them 22 residents at 63 cents per day? You see, that's why the Commissioner of Human Services ain't here today. She had a big meeting with the governor today. Done finished tomorrow. She got budget. But guess what? We here, all the senators are here. We are on the budget committee. And guess what? We going to be there tomorrow. So I want to quickly go to the next senator, Senator Samuel Carrion. You're recognized for your 5 minutes. Oh, Senator Carrion? Okay. Senator Maurice James, you're recognized for your 5 minutes.
Thank you, Mr. Chairman, and good afternoon, Virgin Islands, and to everyone present and attending this important meeting. I want to first of all say that I was listening to Dr. Richards, and it's been 6 months since I've been here in the Senate, but it's perhaps the first time that I've heard someone creatively and innovatively address issues that they have instead of lamenting shortages or whatever issues. So I really want to commend her. One concern I have, though, and that's with respect to the 18 people that were laid off. And my concern is more that these people must have been providing services, and I'm sorry they lost their jobs, but at the same time, I'm wondering what services were compromised or sacrificed by their being laid off, and how are their absence being compensated by who you have left on staff? Can you please address that for me?
Sure. Good afternoon, and thank you for your question. We have worked through, as we were going through the list of the people that were going to be laid off and what their jobs duties were, we also looked to the staff kind of to the left and right of them to see if the things that they were doing fell within their job descriptions as well. Because what we don't want to do is be giving other people jobs that don't fall within their job descriptions. So when we added duties to the staff that was going to be staying on, like I said, we made sure that it was a part of what they should be doing. That's the first thing. The second thing is, I feel like we were right-sizing more than downsizing. We had a lot of staff that, that we appreciate, that contributed to STEAM CC, but there was also some downtime, it seems, at times, I think because we didn't have as many revenue generators. So the staff that we have right now can absolutely support what we need done right now. Perhaps as we get staffed up more, with our revenue generators and we have more patients flowing through, at that point, maybe they would feel the impact of some of the staff not being there, and at that point, we can hire more staff. But with our current patient load, the staff that we have right now is absolutely doing a phenomenal job of carrying out their duties. And just, I know you have, if this is timed, but just to add this really quickly, they are actually coming up with more things to do, because they're so passionate about what they're doing right now. They're coming up with new quality things and extra jobs for themselves. So they are absolutely able to carry out all the things that have been left by the staff leaving, by the 18 staff members who left.
Thank you for that answer.
Thank you.
And it does make sense that once you increase morale, that in fact, people begin to step up and do a little more. I want to ask the Assistant Commissioner of Human Services, On page 6, you mentioned that repairs to window screens, which were damaged severely after the storms, that's one of the issues that you have. And I was puzzled, surprised that window screens, you said window screens and not windows, that window screens would be left unaddressed.
1 minute.
6 years after the storm. I have some other questions, but that one jumped out at me. So I wanted to ask, why is that, and how many maintenance people do you have, and why can't staff, following up on what I just discussed with the previous testifier, someone step up and repair window screens? Can you answer that for me, please? Thank you.
Thank you for the question, Senator. So I cannot speak to why it had not been done before. We do have 2 maintenance workers on staff, which has been a challenge to take care of all the facilities of DHS in St. Croix. So we have 2 maintenance workers on St. Croix, just to clarify. Sorry. And so what we were experiencing with the window screens is that because they had just little areas that were damaged, it was causing the air from the air condition to escape the room at a quicker rate, and obviously that started to affect the ACs. So I think something that may have seemed like a smaller problem turned into a larger problem and became something that we have to address immediately.
And that's what I'm trying to point out, that when you don't fix the little things, they then become big things. And, as you just pointed out, a window screen led to an air conditioning problem. One other thing, the other thing, how many employees do you need to operate Herbert Gregg facility? What would your full, in order to address the full complement of staff that you would need for Herbert Gregg to be operating optimally, let's put it that way? I know that's a difficult one, but please try to address that.
Sure. So what I will say, we currently have a staff of about 44, 45 with an additional 4 to 5 vacancies or so that is operating to the best of their ability currently. As you'll note, there were a number of areas where we mentioned we don't have any staff at all, such as social workers. We could always use more staff, and it also impacts our ability to accept more residents. So it really boils down to looking at our census and making sure that we have enough. We have to make sure we have enough nurses. We're mandated to do so. So we have just enough, but we end up running into challenges. If our staff calls out, if they're sick, then we end up seeing the shortages. But we have just enough for what we need to operate. But I think that we could definitely use some more support services workers, just to make sure that things are as efficient, especially maintenance. Like you mentioned, we would love to have a maintenance worker dedicated to Herbert Gregg that's focusing on that facility. So that's what I would say.
Thank you. Mr. Chairman, I think my time was called. Am I correct?
Yes, but you may wrap up, Senator James.
Okay. Thank you, sir. I just want to end by saying that with 23 people who are waiting, and you really alluded to it, that you can't admit more people until you have more staff. So, you're in a dilemma there. But I want to say that we really need to take care of our seniors in this community. And we have an aging population. So that means that the waiting list will increase. And I'm hoping that the Department of Human Services will in fact start to become more engaged creatively to address these problems. Mr. Chair, I am also again having to have to ask you to take a leave again from your meeting, because there's another meeting that I must attend, but thank you for allowing me to wrap up. I appreciate it.
Your excuse, Senator. Point of information, Senator Marvin Blyden.
Thank you, Mr. Chair. STEM CC, the employees that were let go, do you know if they are receiving unemployment benefits?
Yes.
They are?
Well, they should be able to. There are no issues from our end that would prohibit that. So if they have gone down for their benefits, they should be able to receive their benefits.
Okay, thank you so much for that.
Sir?
Yes, thank you, Senator Blyden. Senator Milton Potter, you're recognized for your 5 minutes.
Thank you very much, Mr. Chair. Good afternoon to you, Dr. Richards, as well as you, Mr. Mears, representatives from STEAM CC. I wanted to ask you one question, one thing that was in my mind when you were giving your presentation about, and you really, your chart was very informative, I think, demonstrating the progressive decline in revenues from 2019 to 2023, as well as the increase in expenses and increase in payroll during that same period of time. I want to ask you about, during the COVID period, wasn't there, like most organizations, wasn't there an effort for the federal government to provide additional funding to compensate for the period of time when you weren't seeing patients, when there was definitely a decline? The expectation of face-to-face contact was that that wasn't happening. Did the federal government provide you with any additional funding during that period just to at least stabilize the organization during this critical time?
Yes, so thank you for that. So yes, the federal government provided funding through grants, but the issue was not so much the grants that we received as much as it was how much the payroll increased. They didn't provide us with $3.1 million worth of grants, and that's where the problem, that's where the shortfall comes from, because we got support, but when you're then skyrocketing the payroll, you cannot make up for that difference there, and that's where the issue comes in. Correct.
Okay.
Correct.
Okay, fair enough. The mix that you demonstrated in your graph, the payer mix, how does that compare to what it looks like just in a typical health center, federally funded health center? Is it normally that sort of distribution as far as, let's see what you had here. The percentage of private insurance, Medicare, Medicaid, self-pay, is that typically how it looks across the board, or is it unique in the territory?
So it depends on what we're looking at. If you're looking just at FQHCs, federally qualified health centers, it's similar to this. Sometimes you'll see a slightly smaller self-pay and a slightly bigger private insurance. But certainly the bulk of what an FQHC is going to see is medical assistance and self-pay, the uninsured, the underinsured. If you're looking at other entities, you'll see a much bigger private insurance, and that will help to offset some of that care. That's why one of my goals is to get more private insurance into the center to increase our revenues, because we are going to see the self-pay patients, and we want to. We want to give everyone access to care, but
that's
we just
the whole
need to get
objective
some
as to
money.
why you exist.
Exactly. That's why we're here. Exactly.
Okay. As far as the 18 employees who were laid off, the severance pay and the accumulated annual leave payout, and I know you said that you've made a good effort to substantially make good on that obligation. Where are we with finalizing it? And you may have mentioned it in your testimony. Do you have a drop-dead date where those persons, who are laid off can expect to receive their full severance pay as well as accumulated annual leave?
So right now we are almost finished paying off the accrued leave for most of the staff. I think we still have 4 people who had larger amounts of accrued leave that need to be paid, but because of our circumstances, that they're one of the people who have to be a little bit more patient, unfortunately, as much as we understand, okay, these people all of a sudden, they don't have a job. We have to take care of them. We want to take care of them. But we have all these other issues that we're trying to address. So we did put them as a priority, which is why almost all of them have been paid their accrued leave. And I anticipate that by the end of this month, all but maybe one or two people will be paid off completely.
Okay. But you are, and you said it, I didn't have to say it, when you're suddenly unemployed, the bills don't stop coming. You still have to pay your mortgage and your student loans and everything else. So I really want to urge you to make it a priority. I know you have a whole lot on your plate, a whole lot of priorities too. Yes. But I want to appeal to you to push that on, high on the priority list, just to put those individuals in a better situation, more stable situation with regards to their finances.
Understood. Thank you.
Okay.
We will make every effort to do that.
Thank you. Thank you very much. Thank you very much, Mr. Chair, for the time.
Thank you, Senator Potter. You see, going back to Herbert Grigg and the Human Services Commissioner, they say you could run, but you can't hide. You see, you ain't come to the meeting today because you got a budget meeting tomorrow, but all of we going to be there to that budget meeting tomorrow. You see, our job is to defend those elderly folks that cannot speak for themselves. Them 22 elderly patients, residents in Herbert Grigg, I've seen them. The vice chair of this committee have seen them. Our president have seen them. All the senators have seen them. They can't speak for themselves, but I know why you can feed them on $5.60 per day. It's right here in your budget. It's right here in your budget. I know why you feed them on $5.60 per day. Because the cook them, her husband buy the onion. They chip in and they buy the sugar. They chip in and they buy the egg, and they chip in and they mix them up. And the people them that walk in there coming out of their pocket to feed them elderly residents. And I ain't want to even get into whether or not the question is you have our residents with soil pampers. So tomorrow, when you come to the budget, we're going to be here. I don't know if your Assistant Commissioner, Ms. Danielle Baptiste, have the answers. But tomorrow when you come to the budget hearing, make sure that your Herbert Grigg line item is not what it is here. We'll now go to our Honorable Vice Chair of this committee, the Honorable Senator Kenneth Gittins, Majority Leader. Senator Gittins, you're recognized for your 5 minutes.
Thank you, Mr. Chair, and good afternoon to all. Herbert Grigg, who's here for them again?
Ms. Martinez.
Good afternoon, Senator. You have myself, Danielle Baptiste, Assistant Commissioner, Acting Administrator for Senior Citizen Affairs, Mr. Alvin Milligan, and Ms. Ana Velez Martinez, Director of Residential Services at Herbert Grigg.
So what good news y'all have for us for Herbert Grigg? What progress has been made? Because it's been quite some time now. We're trying to get even some cooks, kitchen, food service workers, storeroom keeper, I believe it is. Tell me, from last budget cycle, now we into the next one. Have we hired anyone in those positions that I just named?
Thank you for the question, Senator. So in terms of our kitchen operations, we are fully staffed. So we do have enough cooks and storeroom keepers currently.
You don't have enough cooks, Assistant Commissioner. Don't give me that. And this is a problem that we does have when we come before the legislature. I continue to tell you all, you need to say what your needs are, because this is where the buck stops. You're going to come here and tell me that you are fully staffed? That means I'm going to have a hard time convincing my colleagues that you need more people. But I visit Herbert Grigg all the time. It's almost like I live in Herbert Grigg already. but y'all waiting for something to happen before we do something. Again, from earlier this morning, I'm talking about us being more proactive than reactive. You also mean to tell me, based on what I'm hearing, that you still don't have a dedicated groundskeeper or maintenance worker on staff dedicated for Harbert Gregg?
So Senator, in terms of the kitchen, you could allow Ms. Martinez to speak to it as well. As far as we do need additional staff throughout the facility. Like you mentioned, the groundskeeper is one of those. I was told that we do need perhaps one more storeroom keeper in the kitchen. But we do have a cook that we did bring on board that was in another unit. And so as far as Ms. Martinez is concerned, that area, again, right now is okay. As we talk about expanding our beds and our capacity, those needs grow. But we do have other needs across the facility in terms of staffing.
That's a political answer. Again, these employees are burnt out. I am constantly in contact with them, at least on a weekly basis, and I've been doing this purposely because I wanted to see what will happen at the next budget cycle. I know you all coming for budget tomorrow. Still no progress. We still don't have a covered walkway when the food cook to take the food down to the dormitory. I mean, are we really serious? I've asked time and time again for us to have a phase 1, phase 2, and even a phase 3 if possible for the renovations that's supposed to take place at Harbert Gregg. Have we started any of these renovations yet?
Yes, Senator, we have. In regards to the canopies that you just mentioned, those have actually been purchased. We have selected a vendor. They have the canopies, and those canopies will be up by the end of the month. In terms of other renovations, we have had vendors on site doing a lot of repairs. I can speak to personally over the last few months, and we are working with the Herbert Gregg team to prioritize the repairs that I mentioned in the testimony, to identify the funding and to make sure that we are securing the vendors to take care of the issues that they are experiencing. So I would say we are underway with many of the renovations that I mentioned.
We've been underway for quite some number of years now. It's time. I don't know what they're going to take for the administration to make some serious moves.
Time.
Department of Human Services. Thank you, Mr. Chair.
Yes, thank you, Mr. Vice Chair. You know, long-term beds in the community, you know, we have to provide a lot more beds, more facilities for our elderly. You know, the way how you treat your elderly, they come back on you, you know. You know, the border issue with the hospitals. The borders are elderly persons who cannot provide for their self-care, and they end up in the hospitals because other options are not available. You know, the numbers of borders fluctuate. They got about 6 or so in Wang Louis, 13 in Roy Snyder. But the hospital is not a good environment for borders. We need them in these type of 24-hour facilities. And the border problem ultimately ends up as a huge bill for the government of the Virgin Islands. You know, I got the numbers here. I got it from Ms. Farrell here. We looked at all of the elderly communities. We got some from Ms. Martinez. We got them from, you know, from Mr. Williams up at Ebenezer. We put together, we got all a list here of the elderly residents that need additional care. Right now, We need about 140 more long-term care beds. You know, Christopher Finch, he was here before this committee, and he said that the census shows the Virgin Islands has 18,541 people over 65. And based on his analysis, there should be 3% of that number set aside for elderly beds. Right now, we need about 140 beds. So let's go ahead and build 70 on St. Croix and 70 more on St. Thomas. You know, and also, you know, the Human Services Commissioner, you can run, but you can't hide. I'm going to see you tomorrow, Honorable Commissioner. We also need to expand the home-based health care. The elderly people, those that need care, dementia, all of that, we need expansion of the home-based health care. We need more people going out to the homes, visiting these residents. That will help with the border. Also, the personal care services, all of that, human services, they have a big, big job. You know, we have to improve the treatment for our residents. So we're going to go quickly to a second round of 3 minutes. Senator Marvin Blyden, you're recognized for your 3 minutes.
Thank you so much, Mr. Chair. And you're speaking to beds. And in June of 2021, the Department of Human Services appeared before the legislature and stated that a 60-bed skilled nursing facility to replace the Herbert Gregg home will be completed by the end of 2024. And since that time, we have heard fewer and fewer specifics. So my question is to the Assistant Commissioner, if she knows exactly where we are in that process for this planned facility, and also for the replacement of the facility planned for the island of St. Thomas. Assistant Commissioner Batiste.
Thank you for the question, Senator. So as it relates to the St. Croix facility, those funds have not fully been obligated, although FEMA has given us approval for a replacement for Herbert Gregg. So we are still going through the FEMA process to get those funds fully obligated. We just completed our second joint peer review, and now we're waiting for FEMA to finalize the cost estimates and give us the full obligation on those funds. Once we receive the obligation, we're planning on doing a design build. And so we anticipate that we should have our RFP out for Herbert Gregg by the end of this calendar year.
Okay, thank you.
As it pertains to St. Thomas, Queen Louise, those funds have been obligated. We have $65 million for a prudent replacement for Queen Louise home, as well as $1 million for temporary repairs. For the Queen Louise home, we are looking to purchase land, and so we've begun that process. And so I know that it's coming before the legislature for approval for us to move forward with that land purchase. And we are also in the process of putting together our plans to move the residents out temporarily so that we can begin the temporary repairs on the facility.
Thank you so much for that update. That's good news. Let me ask
1
you,
minute.
Let me ask you in respect to social workers or social service aides at the Herbert Gregg facility. Do we have any?
We do not currently have any social workers or social service aides at Herbert Gregg.
Are there any in the budget for this fiscal year? If not, why?
We do not have any in the budget for this year. And to be honest, it really came down to trying to prioritize our positions and our resources. And so because we have a temporary solution in place, while we know that it is not the best solution, we are continuing in using that process so that we could get some additional positions on board for other critical areas, including Herbert Gregg, but just in other units.
Okay, in the last 2 months, how many site visits have been performed by the APS staff? And what is the amount of hours spent with the residents of the facility?
So I'm going to ask Ms. Martinez to respond specifically to this question.
Please.
Yes, you may proceed, Ms. Martinez.
Actually, I'm going to respond to it, Senator Fonseca, Alvin Milligan. It's an ongoing, I don't have a direct number, but I know that the APS staff, what has happened, and I am trying to answer Senator Blyden's question through the chair in reference to APS. What has happened is that APS has been lending the social service aid and also the social worker aid to Herbert Gregg Home in terms of admission. So it's, to say that they went one time a week or twice a week, they may have had to go 3 times a week. So if he could be a little more clear, and then I could probably answer that question.
Well, I was specific, in total, basically. So you can do it through the chair, and in closing, because I know I'm out of time, in closing, has any psychological assessment of residents been conducted, and if so, how often and by whom?
Well, good afternoon again. It's a requirement in order for them to be admitted to have that evaluation done. And that's one of the criteria in getting into the homes to the age. So any resident that would apply to get into the homes to the age, they would have to have this psychological evaluation done prior to getting in there for more reasons than one. As you know, that we are just a nursing home. It's not a skilled nursing facility, so we don't have psychiatric treatment that is provided there at the home. So they have to do that prior to getting in.
Thank you so much for your response. Thank you, Mr. Chair, for the time.
Thank you, Senator Blyden. And real quickly, Ms. Martinez, since we have the budget hearing tomorrow, we'll go into further detail. But the $37.50 that you have now to feed the people, what do you need a month to feed the residents at Herbert Gregg? To provide a proper meal?
Based on the menu and the 4-cycle menu, we're looking at $12,000 average a month that we would need to fulfill the 4-cycle menu.
12,000, okay. And also with the cloth and the clothing, you have $416 a month. How much do you need there?
I would have to get back to you on those numbers. I
Okay,
don't have
get back to me. Also, the generator that you mentioned, what's the cost of the generator? You have any idea? You've received any information?
I received one quote for a 80 kW generator, and it was $76,000 with installation.
$76,000, and you need to get another quote, I'm being told. Also, real quickly, the other item, the medical supplies, you had 8,333. What do you need for medical supplies?
On a yearly base, we're looking at 200,000.
200, so that's the double it because you have 100,000. Thank you very much for Ms. Martinez. Now, I ain't want to hear nothing happen to Ms. Martinez, or I come in looking for all of you guys because she's doing her job. She is charged with managing that 24-hour, 365-day-a-week-year facility with 22 patients. And I've seen the patients, they need 24-hour care. So don't let anything happen to Ms. Martinez, or I coming over to St. Croix. Yes. Yes, Senator Carrion, you're recognized for your 3 minutes. No, 5 minutes, I think you had. Yeah, your 5 minutes.
Thank you, Mr. Chair. And I had to step out to be at another subcommittee meeting, but I'm back. So with regards to Eastern Medical Clinic, when was your last audit done?
Go ahead.
Sorry, Senator, are you referring to our financial statements audit?
Please recognize the mic for Mr. Majors.
That's done.
Yes, proceed.
Sorry, Senator Carrion, the question is, my response was, could you clarify, you're talking about our financial audit?
Yeah, financial audit.
Our last financial audit was done completed for FY 2022. Our financial year ends in February So our most recent financial year, FY 2023, we expect the audit to start next month. Thank you.
So that's starting next month. FY23 starting next month, the last one, FY22. And number of findings, you don't have to list them, but I just want to know.
There were 4 findings, actually.
Four findings. What are you doing to mitigate and correct those findings? You already establishing some things?
Yes, we've actually been working with an auditor. Well, I call it working. We got some advice from an auditor from HRSA, which is our federal regulator, about where we need to start. So we've put in place some wording in our policies and procedures that would address all 4 of those. My expectation is that we will be implementing those. We have started already. One of them was that just to give an example, he asked that, our auditor, asked that we immediately start doing a monthly reconciliation of our accounts. We've been doing them at the end of the financial year, so he wanted them done monthly, so we've started that. And we expect that to continue going forward.
Okay, so you're confident that these 4 findings will be resolved and hopefully in the next audit, you won't have these issues?
That is the plan. When I came on board a couple of months ago, the previous CFO had already left at the end of calendar 2022. So we still have some catching up to do. Our accountant also left, so it's kind of on my plate, so to speak. But we expect that we'll get another accountant soon, and we will catch up on some of the things that were outstanding then and have them rectified before this audit is completed.
Sure. Good. Well, I'm glad to hear that. The monthly reconciliations are going to absolutely assist you in that process. Cost savings in the layoff. What's the cost saving in that layoff?
About $60,000 per payroll. So about $120,000 per month.
$120,000 a month. All right. And please, I would implore that you reach out to the Department of Labor and other agencies like Department of Health and Human Services, the hospitals on St. Thomas, to ensure that these individuals that were laid off can be accommodated in other vacant positions in other government agencies. We need the skill sets, we need their ability, and we need them to stay here in the Virgin Islands. So I would implore you that. Ms. Martinez, good afternoon to you, Director. My time is running, so I want to kind of move quickly. What would you consider the 3 major challenges you're having in Herbert Grigg?
Media, please recognize the mic for Ms. Martinez.
Good afternoon, Senator Carrion. The 3 major challenges would be funding, staffing, and the maintenance, capital improvement.
Funding, staffing, and capital improvement. All right, and I heard some of my colleagues were asking you some of those questions regards to funding, staffing, and all of that has to do with money. All 3 of these major challenges has to do with money. Can you, through the chair, submit what those figures are? So, regards to staffing, you need staffing.
Time.
What would be that cost for payroll for staffing? Capital improvement, how much would you need for capital improvement? If you could submit those numbers to the chair.
Sure.
Thank you. Because our position here is to be able to see where your shortfalls are and see where we can assist you in this endeavor. Definitely, we need to attend to our seniors. We need to expand and be able to have more beds at Herbert Grigg. And you need the staffing and the funding in order to do so. And it seems to me from what I've been hearing that you're barely making it through with what you have so far. So my time has been called. I don't want to continue, but I want to thank Mr. Chair for allowing me the leniency. Thank you, Mr. Chair.
Yes, thank you, Senator Carrion, we're here working, but of course, the community is watching. I just wanted to highlight couple texts I've received here. It says, "Good afternoon. I am an employee at STEM CC, and Dr. Richards and Mr. Mayers is an awesome team. They make us feel appreciated and motivated to come to work." So I think we're seeing that also. There's a lot of people that's involved, and we continue to work. I wanted to go quick to your revenue generation because you did not prepare the budget that's going to come before the legislature, and you're now the team that's in charge. So make sure you have the costs for the 3 additional medical providers, the behavioral health, and also the 2 dentists, so that we can have, and any other things that you need. Real quickly, so with the additional funds that you have received now, are there any employees that were terminated that haven't gotten their full leave? And if not, what are your plans to rectify that?
So yes, there are still some that have not received their accrued leave. We are in the process of rectifying that now. As we mentioned before, almost everyone has received their money. We also have a list of payments that are going out today that should be in their bank account within the next day or two. And then there may be 1 or 2 people after today who still have some accrued leave that needs to be paid because it was a significant amount. Given our financial situation, we're trying to do it as quickly as possible, respecting and understanding that they need the money. They were employed and they are no longer employed. So we want to take care of that, but we have to have the funds to do so. And we are trying.
Okay, good. So you hear that from Dr. Tess Mout. So all you that ain't get your check, if you ain't get that money, call me. I gonna call her to make sure that she honor this commitment, to make sure everybody gets their work, gets their pay. Senator Potter, you're recognized for your 3 minutes.
I didn't even know I had another round. That's very good. Thank you very much, Mr. Chair. I wanted to ask Department of Human Services, I know that regarding the generator, I know that it is critical for a home for the aged to have a working generator. Did you account for this, Assistant Commissioner, in the FY24 budget?
Good afternoon, Senator Potter. That need is not currently reflected in our FY24 budget.
Well, why wouldn't that be a priority matter for the upcoming budget, given the significance of this generator?
I would say for a number of reasons. Number one, while we know that it has been a challenge, we were trying to go an alternate route with being able to provide generator services to the kitchen that we were recently told is not going to be a solution, which was to try to use the existing generator that we had. I can speak for myself in that in becoming aware of the issue, the budget was already underway and we could not then submit it as part of our request. But additionally, we know that we do have our ceiling to maintain, and it didn't allow us to put every single need that we have into that budget.
Okay. Okay, thank you for your response. Dr. Richards.
Yes.
And I know you outlined a number of very important issues that and you just received the leadership baton, basically. You and Mr. Mayers, you guys are the new kids on the block.
1 minute.
So what would you say is the most critical of these many challenges that you have before you, that you are gradually digging yourself out of, what would you say is the single most critical issue that you're faced with and your strategy for getting, at least the ground level?
Okay, Senator Potter, that's a big one, but thank you. I think it's actually two things. I don't think that it's just one because they are so inextricably linked. One is the lack of providers, and we are working very hard to fix that. Once we have providers on board, then a lot of the other issues will start to go away. We will generate more program income. We will direct that program income, at least initially, towards getting down our accounts payable, because that's the other thing that is a huge, huge obstacle for us right now. So program income and lack of providers.
So recruitment and retention of qualified providers is key. And I think you may have alluded to it. Recruiting them obviously is a challenge because you're up against our cost of living versus our lack of our ability to pay a competitive wage when compared to the national average. So how do we get past that? What is your strategy for accomplishing that? Recruiting qualified candidates who want to be here, because if you don't want to be here, this is just a pit stop along the way and you're here for a couple of weeks and then you leave and then we're back to square one. What strategy, I don't know what you have in your pocket, a magic wand. What creative strategy do you bring to the table to enable us to recruit and retain qualified candidates so that you can bill?
Yeah. That's a very good question. I don't know that I have all the answers to that yet. We are still trying to figure that out. That's part of what I was mentioning when I talked about our onboarding team, trying to find, like you're saying, creative ways to make people realize that this is now their home and they want to stay, they feel welcome, they feel embraced. What has actually worked, though, is that we reached out to the community here. People who were in between jobs, who are already here and are already licensed and already vested in the community. And those are the two providers who we have slated to come on board, are actually people who are already here and looking for jobs. So that piece has worked beautifully for us right now because we know that this is already home and they want to stay here. And the other ones are providers in the territory who want to give to STEAM CC just to give back to the community. So initially they're willing to give, a day here, a day there, some hours to get us kind of caught up until we can permanently fill our vacancies.
Thank you. If I may, Mr. Chair, just one final wrap-up question. Regarding in your testimony, you mentioned that you were putting together a team of a grant writing team. I don't remember exactly how you characterize it. Now, didn't we just separate a grant writer? Wasn't a grant writer one of the people in the list of 18 who was separated from the organization? So I'm curious as to how you separate a grant writer, understanding that a big portion of your funds and your survival is tied to your ability to effectively write grants. So tell me how you reconcile that.
So what STEAM CC needs is someone to write grants, but also to seek out other kinds of grants other than our 330, for example. We also need someone who's going to manage those grants and be very aggressive about finding sources of funding. So we have members on our staff who are trained to be grant writers already. So we're actually utilizing that particular person in that space. She's already on staff. So it's not an extra person that we're bringing on, but like we talked about before, wherever we can use someone who wants to do this, who actually is trained to do this, we're going to use that person. So she's actually very excited to be a part of this.
Thank you very much, Dr. Richards. Thank you, Mr. Chair, for your generosity.
Yes, quick question. So, Dr. Richards, when was the last time you've seen a patient?
Last Thursday.
Okay, so you still acting medical director and acting CEO? You have two hats?
Yes.
Okay, so how soon do you plan to, Well, I can't ask you about filling the CEO, but I can ask you about filling the medical director. What's going on? When are those positions? I guess that should be asked for the chair, Mr. Calwood. But do you have any idea when the medical director position will be filled?
So there's kind of two parts to that, and I know this is time dependent, so I will try to do it quickly. As far as the ED, that's kind of what we mentioned before. The HRSA likes us to get a little bit more stable before bringing in a brand new person. So that's the ED person of it, the executive director piece of it. What I actually told the board, because we're in financial crisis, is let's leave things as they are for right now until we are more stable. Because if you're bringing in another person, that's a whole other salary. A medical director can't see patients full-time just because of all the quality and all the other things that need to happen. So if they're going to bring in someone with a higher salary like that, let it be someone who's going to be a full revenue generator. And I can handle this for now. The staff has been extremely supportive. And because the clinical staff is already so kind of organized and structured well, they're actually doing just fine. They're actually doing just fine with me being medical director and them kind of figuring a lot of things out kind of on a day-to-day basis. The center is fine right now until we can get to that point where we can afford to have all the high-level director positions filled.
Okay, good. So what's your patient load visits for the year so far?
My personal patient load visits?
STEM CC.
Oh, that's a good question. I don't have that number right in front of me.
Okay, it's
but I will bring it for the budget.
more than 5,000?
I wouldn't think so.
Okay.
Our total visits last year was 7,068. The year before, 445. So I wouldn't think it would be 5,000 quite for the year.
So probably more than 3,000.
Yeah.
Yeah,
maybe like 3,000.
That's a whole lot of people. Senator. Okay, I stepped out. So, I wanted to say something here that's very important. Because, July is National Minority Mental Health Awareness Month. And, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, act. And, mental health, we have to get to the point where mental health is treated on parity with all the other illnesses. We can no longer wait for mental health treatment. If your child has a broken foot, a bone, or the flu, you go to the hospital, you go to the clinic, you're treated immediately. Mental illness must be treated the same. Mental illness hurts. It hurts, and it hurts right now. I'd like to see the day also when we treat the psychiatric hospitals just like we treat a cancer hospital. Treat mental illness like heart disease. Treat mental illness like how we treated the HIV community a while back. And the law says you don't have to wait. The law is on your side. There's a hotline number, 988. So I encourage the community to call that 988 line, that hotline, and you can get mental health attention. And thank you very much. So at this time, we will ask for Ms. Baptiste. You can go first. We'll ask you to give a 30-second closing. And also we'll ask Dr. Richards to give a 30-second closing.
Good afternoon again, everyone. I just want to say thank you for providing us this opportunity to provide a status of a Herbert Gregg home for the aged. I want to just again thank our hardworking staff for everything that they do in the midst of everything that is going on and all the needs that they may have, and just continuing to show up every day and putting their best foot forward and providing quality care to our seniors. Human Services knows the large job that we have before us, and we are committed to doing our best and to working with Governor Bryan and as well as the legislature to meet the needs that we have. I did want to just make one correction and thank the Friedensfeld Moravian Church who has provided donations, as well as all of our community partners. And I just want to say thank you again.
Thank you very much, Honorable Assistant Commissioner Ms. Denelle Baptiste, for your testimony. Dr. Tex Richards, you may proceed.
Okay. I just want to say thank you again to this body for having us come back so we could present testimony again today. And thank you for your questions. When you ask questions like that, it helps us see things that we may not have been aware of. So we appreciate that for sure. And we certainly appreciate your support. To the 70 staff members at CMCC, thank you, thank you, thank you. They are also special individually and collectively, and they all contribute to our team. And our team makes the dream, so we're going to do it. Thank you, thank you, thank you.
Thank you. And at this time, we'll release all of the testifiers from the well. And I'd like to say a pleasant good evening to all the listening audience. The Committee on Health, Hospitals, and Human Services is hereby adjourned.